So I am recording this meeting. I'm with the London Regional Social Forum. I'm a co-organizer. We've had a few town halls on housing, and we recognize there's a crisis going on right now, and we wanted to bring people together to talk about the issues. So we invited all the candidates, frontline workers, concerned citizens, because this is a crisis that seems to only be getting worse, and we need to take action together and bring the leaders. You people are all leaders. Bring you together to use your great minds and ideas to move forward. So I'm going to do a land acknowledgement, and then we'll move on to the discussion part. If Shiam could keep letting people in.
Yes, I am.
Okay. So I just see that I can't access my land acknowledgement because I'm recording. So let me see here. Okay, I just want to acknowledge that we're on First Nations land, and if it wasn't for their kindness and their consideration when we first arrived as settlers, we wouldn't have survived probably. If it wasn't for Tecumseh and his brilliant tactical maneuvers, we might be the 52nd state. We're on the traditional territory of the Lenni Lenape, the Attawandaron, the Haudenosaunee, the Huron, I believe the Wendat Nation, the
Anishinaabeg.
Anishinaabeg, thank you so much. And we're close to Oneida, Chippewa, the Thames, and Delaware Nations. There's about 11 First Nations that call London and area home. We recognize that it's really important that we implement all the recommendations, the Truth and Reconciliation documents and tenets. We're horrified at what's happened to missing and murdered Indigenous women, and we want to have everything fully investigated and support for making sure that it doesn't continue. The residential school system was horrific, and we certainly want to support First Nations in finding everything out about it and seeking justice. The land back lane and the Wet'suwet'en, they have title to their land. The pipeline shouldn't be being built across their land, so we stand shoulder to shoulder with them. And we recognize that the First Nation culture and teachings are, really extremely important for our survival due to climate change, and just we should support them and speak to them nation to nation. So with that being said, we want to talk about the crisis in housing and in homelessness and harm reduction. It's all intertwined with mental health, and healthcare is also in crisis. Now, I've invited people from some of the agencies locally. If anybody's part of an agency and would like to come forward and speak about what they're seeing on the front lines, if they want to share an idea about what we need to do moving forward, just put up your hand and we'll go to you first. I've invited people from all different organizations. We know that there's 5,000 families that are waiting for housing, sometimes up to 10 years.
Jeff, you muted yourself.
Jeff, unmute yourself.
Jeff, you're muted.
Hi, did you guys hear the land acknowledgement?
We did. It was just after that.
Okay.
Just a minute ago.
Just in the last 20 seconds.
Okay, so sorry about that. I just like to invite people from organizations that are dealing with the homeless and housing to put up their hand and share what they're going through. If the service we're providing isn't meeting the need, do they have any suggestions for how we can improve on what we're doing? For instance, there's 5,000 families waiting for housing, sometimes up to 10 years. There's at least 1,000 people waiting on the streets, in doorways, struggling, getting turned away from organizations, not having food sometimes. And with the opioid crisis, we've lost 60 people in the last year, possibly 150. It's just mind-boggling that our fellow citizens are dying in record numbers, and I know we can do better, and it's horrific. So is there anybody that wants to take the floor first? Okay, why don't we go to healthcare is first, and we'll just unmute, ask you to unmute. And then we'll go to Lindy Taylor. Healthcare is.
Healthcare is voting. You have the floor.
Mute. There we go. Okay. I think that if we look at the homelessness, the mental health, and the harm reduction of the opioids, there's a health component to that, and we've deinstitutionalized into community-based settings that are ill-equipped to deal with these situations, and they're treating it as a social issue, and it's not a social issue, nor is it a criminal issue. It's a healthcare issue, and we've devaluated the value of nursing education and what that leads to better outcomes for these people. There is a piece for the social workers, but they're not being hired. We hire people with no social work degree. They are just caseworkers with a bachelor's degree of whatever. And they lack the pertinent information and knowledge base to make good decisions for clients that are usually more than not confused. And the navigation of the healthcare system is a maze unless you're educated in navigating the healthcare system. Luckily, I have good insight that I can get through a system really quickly. So, and I know the language of it, so, I can get outcomes quicker, but that's what nursing can do with dealing with complicated case management. And we've just downloaded it to other people that are ill-equipped, right? And we need housing. Housing is a basic element for stability. Sleep, we need sleep to be able to think. You need to eat, you need to be out of the weathered environments. We don't realize we take housing for granted, which other people have given up on, right? So if we don't deal with housing, then the other pieces of the puzzle aren't going to work. So that's something that is in the hands and the control of council on a municipal level. The funding piece is about the provincial level. So we need people in council that can understand those two pieces and work with provincial parties to advocate for the weakest. So that's my stance.
Okay, that's awesome. So you're recommending we need more housing, and we need to work with the municipal and provincial governments, and we also need more nurses.
Of course, nursing in the sense of the addiction and the mental health piece. If they work at people think we need more mental health beds, but the funding has been given to addiction and those rehab centers, but people are not being put in rehab centers, and they're being put in rehab centers when they're not stable enough to handle what rehab center is. I have to realize that some of these people are very uneducated, so until they're stable to sit there and learn groups, they didn't go to university, so their grasp of understanding concepts and logic is a little delayed to the point of when they've been more stabilized to sit there for 8 hours, and if they aren't ready, as they say, they get kicked out of a program, right? So there's got to be a bridge gap where they can gain some stability, and they don't need to be in a hospital, mental health hospital, sleeping all day, right? Because they're stabilizing in a hospital and getting on medication, so they stabilize. So they don't have a lot of they have programming, but those programs are not in hospital, they're outpatient hospital, and there's wait lists for them. Like, like it's never ending with wait lists, and you get bounced around from agency to agency with a wait list. And, people don't want the rejection. They want answers and they want to be heard. So I think if you don't hear them, then you're not helping them with their mental health, really.
That's true.
And that's partly what the doctors are. Doctors are very highly trained in understanding the frustrations. So they usually work on outcomes. So if they hear what you're saying, then they direct you in the right direction. And usually you get, groups and psychotherapy. And, everybody's view on therapy is different. So some people might do art therapy, might be a better skew than to have DBT, right?
Mhm.
They need to process some stuff. They don't need to deal with the emotions because they have a, borderline personality disorder, so they need to deal with some other areas of stability before they deal with their relationships and boundaries.
So we need a lot of supports for people with mental health issues that aren't siloed.
Well, we use the word supports, but it's what do they need? Are you really listening to what they want, right? Like, what are their basic needs, right? And sometimes telling them to do therapy isn't the right question. They don't want to hear that yet. That's not the right answer for them. So I think with a nursing care plan, you kind of have certain things that are black and white and you put them together for them. And if they don't work, well, you try something new. You know what I mean? Like, you evaluate it. And I think that's how they use some of the case management, but it's not the right approach because they're setting them up for failure, right? Once they fail so many times with and especially if they have a mental health issue like a depression, once they fail, they give up hope on everybody. Like, they don't even ask for help anymore. So you always have to keep that relationship working, right?
Yeah. Can you just summarize, and I'll let some other people comment, but thank you very much for sharing.
Well, it's just education. They need to be properly educated in addiction and mental health. You can't just hire somebody with a bachelor degree that doesn't have, and that isn't being interned by people with those education degrees, right? With certificate. If you work on a nursing floor, you have to have a mental health certification, right?
Yeah, for sure.
You don't go in and be an addiction worker when you don't even have a diploma in addiction, right?
Yeah. So you're maybe want to have some criteria for people who are looking after vulnerable people. I'm just going to go to Indy Taylor and then Diane. Thanks so much. Healthcare is voting.
Yep, no props.
Thanks. Indy Taylor.
Hi. So I'm not with a specific organization, but I graduated from nursing in 1979. I spent a lot of my nursing career in psychiatric nursing and geriatric nursing, including community. And I have to say that I have watched us go downhill to the position we're in now because of decisions that were made by the government. I'm sure most of you are familiar with the old psychiatric hospital on Highbury. At one time, that was similar to other large psychiatric facilities in that the patients participated in maintaining it. There was farming, there was gardening, there was all kinds of things where they learned skills, had a chance to develop self-worth and a sense of agency. And then it was decided that was taking advantage of them. So what happened was, because I was working there, what happened was they had nothing left to do. So they sat in the halls and smoked. And that's pretty much all they did. And then the government came along and decided they should move everybody out of the hospitals into the community. But when that happened, the plan to provide for those people was not well thought out. It was not sufficient. There was not funding. There was not the leadership or skilled people to make that happen. So now we're in a place where we've got, and I should mention, when I worked there, they were moving people out of the inpatient hospital to the community, and some of them had lived there almost their whole lives. It was their home. They moved them from a place where they had lived for 20 years with their meals provided, with group activities, with socialization, and they just moved them into the community, into halfway housing and different things like that. And that was completely the word's gone. It was just asking for a disaster, which we've seen. But if we're going to address this, I do agree with the woman who spoke earlier about education. I think that's important that people are educated. But I think we need to go back to the beginning. I think we need to go and look very closely at the social determinants of health, which include income and socialization, medical care, housing. It's a long list. And it's interesting to me because I learned about the social determinants of health probably in the 80s, and they were going to implement this, and they were going to use this as the basis for making change and planning and setting up organizations and supports. And really, unless we address those social determinants of health, such as poverty, we are going to continue to have the same problem. It is everything that I have seen since I've come back to London, and there are good people doing their best, but it's all stopgap. We have to address the underlying issues, and those issues were recognized and identified as those social determinants of health a long time ago. And so my challenge is to anybody who's running for council, or anybody who's going to work with them around issues of homelessness and mental illness and addictions, is let's get back to those determinants, and let's get back to addressing each one of those, because they are foundational to change. Without meeting those, without providing those things for people will continue to falter, to fall between the gaps. And in the worst case scenario, we know that there are overdoses and there are deaths. I lost my stepson to a fentanyl overdose 3 years ago. So this is very personal, and that the problem is, I saw with him, there's just, everybody is struggling for housing and money. And I think we need to look at those things, take them apart, and find out what are the best solutions. So for instance, is our best solution to poverty a universal basic income? So we need to take these apart and come up with the short lists of what's going to work best to address each one of these things, because once those are addressed, once those are at least underway, we have a chance of making permanent change. The stopgap stuff, that's all it is a Band-Aid over a gaping wound. And I also speak from personal situation, because I was a nurse until 2014. I had to have brain surgery and became disabled. So this led me into a whole new experience of housing and disability benefits and all kinds of things. So I've become I've educated myself as much as I can in that, but I strongly believe we have to get down to the basics, and those basics are the social determinants of health.
Thanks so much. So I just want to lay down the ground rules for people. Thanks so much for sharing. We just want to try and hear from as many people as possible. So people trying to summarize their talks as much as they can, and appreciate you just share. And also just try and be respectful of everyone. We'd like to hear from people from all over, and especially frontline workers. So we'll hear from the next two people, and then I'm going to ask Jenna Rose maybe to speak on what she's seeing on the front lines, if she feels comfortable, and maybe Jacqueline as well, if she wants to talk about what we need to do. So go ahead, Diana Devine.
Hi. Okay, I kind of have a bit of a question that I'm hoping as many representatives as possible can maybe answer. Here in London, we have several so-called housing and homeless prevention programs all being funded, all of which I've been part of for several years, and I'm still struggling to not end up homeless come January 1st. So my question to all the councillors and mayoral representatives here today is, what would each of you do if you were to get the position you're going for to actually make these programs do something more than just maintain files for years and years on end? I got on RGI list. I got told that was a 5-year wait. I've now gotten what they call a COB benefit to help with rent, and I'm still struggling due to lack of affordability because the COB benefit is based on calculations from a year ago. And we have all of these programs, and all I've had happen for me is my file just keeps getting updated and shuffled and updated and shuffled. And these programs are receiving funding, but they're not actually helping the people. So I want to know how you guys plan to make these programs actually work, rather than just offices receiving funding to shuffle paperwork and maintain files.
Can I jump in there? I don't know if can everybody hear me? I'm Sandy Thomas, and I'm one of the mayoral candidates. I just wanted to go overall before I answer Devine's question. I'll be 3 minutes or less. One of the main things, this is very dear to my heart. I'm also an addiction counselor, and I understand in regards to providing more wraparound services for individuals that are suffering from mental illness or some sort of addiction. I'm working right now with Canadian Alliance to End Homelessness, getting some training. So when I'm in that position, we can go full force in getting more nurses, more people that will be trained in that field in regards to providing more wraparound services. We're not just going to be putting people into homes and leaving them, but we're going to now be providing wraparound services as they've done in Ottawa. We're going to be doing that more here. There is some here, but we're going to be doing more here and letting people move to the attainable housing, and even bringing a program for rent to own as well. I'm going to try to answer Devine's question as best as possible that I can. The situation that we have here now is, where is the funds being used and how we can allocate them to be used for the people. You have to understand, when you don't have people in the city that have gone through these lived experiences, they don't understand. No disrespect, but it doesn't understand. When you have somebody that has been there and understands it, can look and see, this is where we need to be using the money and making sure that we can make sure that we have enough housing. I say that, I know there is some developers. I have a meeting at 7:15 with a couple more developers in making sure that if we say that we have 500 or 600 people that are chronically homeless or episodic homeless, that we can provide this to them within a year period. I'm not a person that's going to say we're going to get this 600 or 5,000 homes. I want to make sure that when I come, we have that signed and delivered. And so the problem that we're having now is making sure that when we say we're going to do something, the action is being done. And that's what I'm looking to do, not to sit there and make a plan and then it gets postponed. We can't do that anymore. These are people's lives we're playing with. And so I want to make sure that each person that is out there and they need a home, that they get a home and it looks like a home. We do have a shortage. I know that there are builders that are building some affordable housing to make sure that that can happen. Right now, the city is extending and doing their work at the old Victoria Hospital, getting that up and done. That does take time. And so we're to work together with everyone, just like what this organization is doing, having this more, taking down those points, as Indy said, in regards to the social deterrent, making sure that we're underlining the issues, making sure that we're coming up with answers for the universal basic income, which I know that the federal government is looking into to increase, but working with individuals in our community to making sure that every voice is heard. And that's what I'm all about, making sure that we have working groups like this and making sure that everything is being done and reporting back. So we're not going to have meetings like this and then nothing happens. We'll say, okay, our action is to do A, B, and C and report back as soon as possible, because it is people's lives and we're supposed to be a community. And so that's my overall question and answer and response to all of that. And I want to just thank you so much, Jeff, for doing this. And I really hope that it's going to be a continuation, because we need to have these talks and to make sure that we are taking these notes down and then driving it back to you guys. Thank you so much, Becca. I'm writing that down because I want to do some more research into that. Thank you. Appreciate you.
We can't hear you, Jeff.
If any other candidates want to speak, just raise your hand and you can share some of the comments on the 10-year waiting list and the question that Diane described. But right now, let's go to Jacqueline Thompson and hear what she has to say. Hi, Jacqueline.
Yeah, I'm mute and all that sort of thing.
Really nice to have you, Jacqueline. Did you want to answer her question, or was there another point you wanted to make? Or
I just want to say to all of those who are running for council that we have an opportunity to elect you. Don't get the opportunity to elect city staff, and they're going to bring to you many proposals and many solutions to homelessness and the housing affordability issue in our community. I just want to say that affordable housing is not synonymous with under market rent housing. All of the monies that have been spent in our community in the last few years, or the majority of the money that's been spent, has been spent on under market housing. So all of the affordable housing dollars have been lost by giving it to developers to develop rents at 80% of the market rent. That money is now lost, and we haven't built the affordable housing that would actually house people that are the 5,000 families and individuals that are on the waiting list. So let's reclaim our terminology. Affordable housing would go back to the Affordable Housing Trust Fund that had a very succinct and a definition in the policies, which staff took away, was that 50% of the housing that would be built would be for people that earn 30% of the median income, and at least 50% of those units had to be for folks who were disabled. And we have not met those targets. The Affordable Housing Trust Fund has been spent, but not on actually building affordable housing. So the folks who are disabled that need supportive housing, that they need to have supports to stay housed, they should be 50% of the folks who are getting those housing. I believe that Indy spoke very well about the social determinants of health, and we need to go back to those. And thank you for putting this together. And please, if you do get elected, help us to reclaim our terminology from the city staff that's taken it away.
I don't think we could have heard you, Jeff. I think you had said something, but you were muted. You're still muted.
I'm sorry, I'm muted. Go ahead, Sam, and then Hava, Jenna Rose, and then Michael Van Holst, please, and then Pratt.
Okay, thank you very much
Pratt.
for thank you very much for calling on me, and thank you very much for inviting me to this meeting. Housing issues, housing justice issues, affordable housing, tenants' rights has been an issue that's been very important to me my entire career going back to law school. My law practice days, I was involved in tenant rights issues in California. And when I got here to London, I started working on housing issues. So I was on the Housing Advisory Committee. Right now, I think everybody's talking about the housing crisis. And all of the candidates, all of them, are saying, I want to do something about the affordable housing crisis. And you have to sort of separate out people who have made a life commitment to housing justice issues from people who are just sort of taking this up as sort of a very easy campaign slogan. So I want to limit my comments right now to things that are specifically within the jurisdiction of the city, things that specifically the city can do, and things that the city has done wrong. I think one of the worst votes of this council session was the 10-3 vote back in June, not to get a costing study on rent safe. We need rent safe. We need an equivalent to rent safe. And there was very good work done by Acorn and other groups to promote rent safe, but there was a really nasty letter from the landlord lobby telling council to just drop it. And yes, this is what council did, because council is in the pocket, and I'm going to say this, of developers and landlords, and we have to stop that. Somebody just said, we have to be ready to stand up to staff. The status quo is not going to work. We need to do better code enforcement. The city cannot control rents. That's a provincial issue, okay? But what the city can do is much better code enforcement in terms of the health and safety. The city, the actual housing that the city runs, London Middlesex Housing Corporation, is just dreadful. The city is one of the worst slumlords in town, and we can't expect the city to do a reasonable job policing all the other landlords that they should be sort of regulating if they are not going to take care of their own tenants. So I'm going to just cut this short, but I just want to express my sheer disappointment with the current council. The council majority has not been working in the interest of tenants, and this has to change. So that's it.
Okay, thanks, Sam. Could we hear from Hava and then Jenna Rose and then Michael, Prab, and Khalil?
Thank you. I'm curious what the current candidates think of the London gentrification plan. This plan was passed, I believe, in late 2018. Anyway, it was well before COVID. Part of that plan involves taking down London Middlesex housing buildings in the downtown core, tearing them down, putting up luxury condominiums, and quote unquote, integrating people living in poverty with people who are middle class and can pay luxury condo rates. I want to know what the candidates are going to do, particularly Khalil Rahman, who is one of the mayoral candidates, and Sandy Thompson, I believe, is the other mayoral candidate. I want to know, do you support a gentrification plan that will, number one, reduce the rent geared to income units in the downtown core and move tenants on RGI to the periphery? because this is the long-term plan from London City Council.
Thanks, Hava. So if we could just defer that for just a moment, I wanted to give Jenna Rose Sands a chance to speak on what she's seeing on the front lines, and if she has any suggestions where we should go from here, if she feels comfortable right now.
Hi, thanks for having me. I'm Jenna Rose Sands. I'm the director of Safe Space London, and I was part of the Forgotten 519. I was actually talking with my staff today. There is absolutely no plans in place currently right now to deal with the winter response. There's going to be a lot of people sleeping on the streets. There is going to be an increase in deaths. We're going to see an increase in frostbite, loss of limbs, loss of motor skills. We are prepping for people on the streets. Now, on that note, I know that Michael Van Holst is probably going to go right after me and say that he put forth something to give the winter response to the ARC. And I think my response to that is going to be that, you know, he would know that wasn't the best idea if he had talked to frontline workers. And we're talking about housing. We're talking about people in the streets. Housing is complex. It's multi-tiered. There are people that have housing instability. There are people that have places to crash, but not affordable housing. And then there are people directly sleeping rough. With City Hall and Council and all of these lofty ideas, we're in an election. It's very easy to say you're just going to go to developers and make houses. You're just going to do it. You're just going to make it happen. It's very easy to say that and to make that promise. And I think a big issue is that we believe those promises without actually thinking about how that's going to happen. This needs to be led from the front lines. We need to hear what people who experience housing instability and homelessness actually feel are the systemic barriers that prevent them from being able to be housed securely. And a lot of it, you know, we're seeing coming down the pipe where people are like, we need more police to police the homeless. We need this. And we absolutely don't need more police. We don't need to hire 60 new police officers. We need to take that money and we need to dump it into a collapsing workforce of the social services. And I will tell you that the social services, outreach workers, frontline workers, people who are supporting the unhoused, medical mobile teams, the workforce is collapsing. People are burnt out. We have no options to give anyone. We have nowhere to stay at Safe Space. We're about to put out a call. We need sleeping bags that can withstand minus 40-degree weather, because that's the reality we're dealing with. People are going to lose fingers, thumbs, they're gonna die. And that's where we're at, because we have no winter response. Winter comes every year. And we are just going to start this conversation once the new City Hall, like the new council, is elected. We're going to start that conversation. Nothing is going to come down the pipe. We're going to bungle it. We're going to throw money at it. It's not going to work. It's going to be a dumpster fire, which we have had months to do this. So for any incumbent who's coming back on City Hall, what have you been doing? That's my question. And for some of the mayoral candidates and folks that have been on City Hall for 1-2 terms, this situation has exploded under your watch. So why should you be coming back again? People are going to die. And now City Council, people that want to be reelected want to hire more force, more brute force. That's not going to work. That is not good. Just to give you an idea, London has over 580 people in the police services that are on the sunshine list to the tune of $74 million. That's not all of the police force. And yet we don't even have money to find beds, to feed people, to give them socks. We have to beg our communities to find sleeping bags, tents. It is bad. And it's not about, like, right now, this is the emergency. This is right now. People are going to die. And the front lines, we have been screaming about this forever. So here's what I am looking for in candidates that aren't going to sit there and ask me give a million promises. I'm going to do this. I'm going to do this. You don't know what you need to do because you're not on the front line. So you know what you need to do? You need to talk to all of us. And when we say we need funds to get tents to people because there's nothing else, that's what we need. You know, We don't need meetings. We don't need huge coalitions. We don't need minutes taken and Robert's rules. We need things to keep people alive. So you want to solve some of the housing crisis? Actually talk to people that are unhoused, talk to workers, talk to medical teams, talk to outreach teams. You know, this solution, this problem was significantly created in boardrooms. It's not going to find its solution there. So, I mean, this moving forward, it's easy for candidates to tell us, oh, this is what I'm going to do. I'm going to da, 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 da. But nobody is saying, you know what, actually, I don't really know the full thing. So I'm going to take some time and really go and meet people. I'm going to go talk to people. Maybe I'm going to go ask to go out on outreach and meet people. Maybe right now, I don't know what to do, but we're going to get sleeping bags. We're going to get tents. We're going to listen. So, you know, I hear all these things, you know, Van Holst, you put something forward towards city council and thankfully it got shut down because it was a terrible idea, but you didn't ask us, you didn't ask the people. So, I mean, anyone who's coming back on City Hall and wants to, this happened under your watch. What's going to make it better? I just don't know if we should be voting anyone who's had a term this entire time, because this is bad. So
I just wanted to add to what you just said. You're speaking my heart, because that's what I say all the time, that we got to speak and hear the voices of those that are in it. And I'm my heart, because that's exactly what I always say. We can't do inclusivity means bringing all the voices to the table. You can't make a decision without going to the ones that are going through it, the frontline workers, to our friends that are in our community that are unhoused. Hear what they have to say.
I think
And this is what I do.
end,
I go and I meet them and I speak with them. Sorry, I just wanted to say that. Thank you, because you're
Sandy.
speaking to my heart. Thank you.
I just want to say, like, anyone moving forward, like, you'll hear a lot of people be like, oh, we need more police officers because there's no police officers to respond to these things because they're gummed up with dealing with the unhoused down in the downtown core. You know what? Maybe if you put in the money for the people that are actually who are social workers and who signed up for this job, signed up to work with folks who are unhoused and vulnerable, who went and got the training, the disclosure training, the safety training. Maybe if you gave them money to actually do their job in a healthy way, they could be the pressure release valve for the police, so the police could go do police things and they're not gummed up being social workers. But people are like, we'll just hire more police. Let's just hire more police. That's not, while the social workers, like the social services, we just are at the same. We're burning out. The entire industry in the city is collapsing and it's just going to get worse. So I think when you're thinking about voting, folks, and you're thinking about the homelessness issue, you know, if you're not working the front lines, you're not working in the organizations trying to help, then you know what? Don't give me promises because you don't know. So this should be led by people. I'm looking for candidates to be like, you know what? I actually have no idea what the hell I'm talking about, but I am so game to like hear what I need to do by other people. You know, candidates who have that humility, that's what I'm looking for here. Not just more promises like I'm going to go and do this. You don't know. So happy voting. Get angry because people are going to die, folks. And I don't think the same council should be voted in because they haven't done anything for 4 years, 8 years. So happy voting. Sorry, I'm so angry. I'm pissed.
It's understandable, Jenna Rosen. Thanks for the personal sacrifice you and all the frontline workers have made for so many years, and without the proper supports, doing the job of 2 and 3 people, and being you know, suffering PTSD for where you have to work. But I'm just wondering. I just read that the mayor of Peterborough declared a state of an emergency, and so did St. Catharines and Thorold. Ottawa and Niagara Falls. So is that something London should do? And should we push the new council to do that as soon as possible?
Oh, it's the London way to be the last ones to do anything. Or as I like to say, you know, it's the London way to like, let's not and say we did. London wants to be a leader, but they can't lead in anything social wise. You know, we need folks that are going to be like, actually, yeah, this is a terrible housing crisis. And At this point, we're the laughing stock of many other cities who are watching us
Yes.
burn,
Yes, we are.
and
Yes, we are.
and we're not going to declare that. We're not going to declare that. We have close to 500, 600 people sleeping rough currently right now as the temperatures are turning. Just so you know, on any given hour in downtown Toronto proper, they maybe have like 300 to maybe 400 tops. Our rough house sleeping folks eclipse the GTA. Like, that's gross, but that's like our claim to fame. We're always that in London. So, that's just how it goes. It's a no-brainer. We should be declaring an state of emergency regarding housing. The fact that we're even debating that is shameful, but that's
Okay.
just the London way.
Thanks so much for being so passionate and sharing everything, putting it all on the table. Really appreciate your passion, Jenna Rose Sands, and I'm so sorry you have to go through this as a worker.
I mean, we're all going through it. I just don't get the benefit of, many of us don't get the benefit of turning away and saying maybe tomorrow or not in my backyard,
Okay, so we're just still has her question about gentrification and whether City Hall, do they councillors support this? It's Michael Van Holst's turn, and then Prob, and then Khalil, Ramal, and then Healthcare would like to speak again if there aren't other people. Go ahead, Michael.
Thank you. So I do want to acknowledge a great point that was made earlier on, that the thing that we call affordable housing, or what has become the term affordable housing, has been negotiated by our staff, which is 20% off of fair market rent for 50 years. And I think everybody recognizes that $2,000 apartment being offered for $1,600 isn't going to help the kinds of people that are most in need. However, I have talked with developers about that, and they realize that that's a financial, that $400 a month for 50 years is a financial commitment. It's worth something up front, and are willing, as was suggested by a previous speaker, to provide that, so that we could turn the money over to groups like Indwell or Homes Unlimited to provide something in the short term. They're the ones that are providing the housing with supports. And I think that housing with supports model, or wraparound services, as was described a little earlier, is what's really needed. It is, if people are disappointed with the city, I share your disappointment. I think there's many ideas that we could have tried out. A couple years ago, I said, hey, let's do a pilot on temporary mobile shelters, which I think are an option. And of course, Arcade Mission thinks they're a good option as well. They've got them in the back there. I did try to give them some instantaneous permission to do that. Unfortunately, it was rolled into a zoning rethink study that's going to conclude at the end of 2023. So unfortunately, that's going to happen. I noticed there's quite a few, or a number, that I've talked to, faith groups that are interested in helping out in this way too, and that's also something that our own bylaws trip ourselves up with in terms of assisting. So I fear that sometimes we just get in the way of doing that. But there was also a motion to look into having faith groups be able to use shelters like this as well. And when you think that there's 274 faith groups and many other secular groups that are hoping to help, but that number alone, if they had 2 beds each and were able to look after a couple of people, that would be 550 beds. And so we go, you can see there's a possibility, if we get the whole community involved, to deal with this problem. And perhaps the next council will have an opportunity to expedite that as well. Of course, we have a deficit of housing in London. There's simply not places to put people, and that was it. A couple of years ago, staff said, well, we don't need any temporary shelters because we've got this housing first model where we want to take people and put them in housing. Right now, they'll tell you that there simply isn't housing. It's simply not available. So it has to be built, and the way it needs to be built quicker is again things that have to do with our building department and the policies and how long it takes to get permissions. So those things need to be worked through. I think we've also got to look at many of the opportunities that we have. We've got surplus lands. We've got the entire Wellington Road that's being widened for BRT. So we're taking down a bunch of houses, but there's still a great depth to those properties. There's a place where the city can do things. I'll point out that there's a couple of affordable housing projects going on in East End of my ward, Thompson Road and Elm Street. Elm Street's really interesting because the city is building it. It's got community spaces on the bottom, 5 rooms for full daycare, and in the top floors, 40 some odd apartments of varying sizes. But we're selling it to the Ontario Indigenous Housing Service. And what I guess that does 2 things. We've got a group that actually has experience in helping their tenants, but we also have a fistful of cash that we could use to build the next one. And I think that's what we want to do is do that. And that was kind of the idea behind the Housing Development Corporation from the beginning. Finally, we're seeing some results from it, but if we can build what we need where we want it, then we can turn that over to the groups that will probably do a better job of helping the residents in there.
Can you summarize your point,
those are
Michael.
yeah, okay, so I think I've addressed a few of the issues, so thanks.
Michael, there's a specific question in the chat, which is why did you vote against rent safe? Number of people have spoken to the benefits of rent safe.
Oh, thank you. Yeah, happy to speak to that. So the project of rent safe was to make sure that every rental unit was inspected.
No, it wasn't. No, it wasn't, Michael. No, it wasn't. I'm sorry. I have to interject here. It was not. It was that each building was inspected, and then if there were further problems, they would go further in and then do individual building apartments and units. And this is where the argument keeps coming up in council, and it frustrates. I've been to many, many council meetings as you know, Mr. Van Holt, you've seen me there as a public participation, and this is where we always butt heads. Nobody has ever asked for every building, every unit to be inspected. And nobody has ever asked to have the number of people hired that Toronto has, because we're not as big as Toronto. And these feeble excuses that council keeps coming up with and then putting it off and putting it off and putting it off just has to stop.
Okay, so thank you. That may be correct. We've got a lot of buildings that I don't think need to be inspected, and that was the idea. Are we going to spend the money on inspectors or spend the money on people fixing things? And that was the idea. It seemed like
the money comes from the landlords, though. That's what you're not hearing.
Exactly.
It doesn't come by the landlords.
By the licensing fees. And any infraction fees that they get, any fines that they get for their infractions. There's very little money that should come out of the city if this program is run properly. There is absolutely no excuse why city council keeps putting it down, except for the fact that councillors have interests in these developments that they don't want their interests being touched, and that's wrong. Any councillor that has a vested interest in these developments should not be allowed to vote on these situations.
Okay, well, I think anyone who has vested interests then have to declare that as a pecuniary interest. However,
They don't.
There we are. I thought the great things we did previously was take on, in terms of bylaw enforcement, was the issues of bed bugs and roaches. So there was a situation that the health unit, people would call the health unit, not necessarily anything would happen. But now they can go through bylaw, and there's some enforcement that takes place there. And there's some action that the city can take. And so previously, people were wanting some action. And I think I would rather see whatever money we pull from the people who own the apartments, et cetera, be actually used for those things. So there was the idea, we can inspect apartments, but none of that, not a penny gets spent in fixing them up. So if we're going to have a program, let's have a program that actually does the work that people are demanding.
That's what the Rent Safe program is for, Mr. Van Holtz.
Okay.
Okay, thank you very much, Michael. And if you could have another look at that, we'd appreciate it.
Sure.
So let's go back to, I think it's Prab Gill, and then Khalil, and then Eric, and then Dana Lynn.
Well, thank you, Jeff. Can you hear me?
Yeah.
Yeah. Well, thank you everyone for being here. I believe we're all here to actually connect. Two reasons we're here. We're connect and join hands, and then possible solution. Just wanted to remind myself and everyone, in order to understand homelessness, you have to have human values. Without it, you cannot understand it. You have to be human. You know, I have a question for everyone, whether they're running or they're represented as a constituent, whatever it is. Are they certified in human values? That's what it is. Okay, so put yourself out there on one colder night and say if you lost one night there. Bring your children there, see how you feel. As long as we do not connect and listen, there's no solution. You have to connect with those folks and feel their pain. Put your foot in their shoe and feel what they're feeling. We talk about affordable housing. Have anybody talked about sustainability? How are we going to sustain it? We go back to developers. That's a key right there, developers. But why aren't we calling those developers in these meetings actually? You know, in councils, we are giving them the say and, you know, having them to act as a leader. They're not leaders. They're there as a business personnels. They're there with their proposals. And as a leader of the ward or city as a whole, as a mayor, our job is to work collectively, collaboratively, and tell them, these are the requirements. Fill those requirements, come back to me, and then I'll sign off with your project and permits. We're not doing that. It feels like the developers are acting as leaders and we're in their pockets. We need to get out of their pocket and act like a leader. We have misleadership at every level, and that's the thing. Number two, we're not going to build affordable housing with a snap of finger. We all know that, right? Have everyone thought about adopting a homeless family ever? We're talking about it. Everyone's here to find a solution. Have anyone thought about it? Let's adopt a family. How are we going to do that? We have faith groups, whether it's Arcade, Salvation Army, or Men's Mission, or it's a Christian church, Catholic, or even a Sikh temple. Are we talking to our faith groups and telling them, let's adopt these families so we can get them off the street and give them a shelter specifically during winter time? I think we need to address these issues to the faith groups. And also, I'm not here with an answer. I'm telling you, I'm just here to connect with everyone and willing to work together as a bigger force in collaboration. We're here to join hands and work as one team. Remind you, one team. We may come from a different backgrounds professionally, culturally, or even with the thoughts. But our main concern is to fight, and put homelessness to end. That's our main concerns. And instead of pushing a vehicle from both sides, let's push forward so we can get someplace. Isn't that what's been happening, Jeff? We have meetings, and where we get to, right?
Absolutely.
Exactly. You know what I mean? So the thing is that let's be human. I want you to go out there in downtown whenever you can, because I'm there as a humanitarian aid coordinator. I'm there almost every day. I had coffee with those folks. I eat meals with them. I celebrate my kids' birthdays, our anniversaries. You know what? I tell them, you're part of me. You're part of the society. We have abandoned those folks, and yet we talk about solutions. That's hypocrisy. We need to fix ourselves first and ask this question to ourselves. Are we in it for the right reason? Or are we showing, just we helping, so we get our name out there? And then I think someone brought it up that we're running as a candidate, and that's why we have this as a platform. No, we should not have two platforms. There should only be one person, whether they're running for a candidate or just being that person alone, right? So let's bring our education, our profession, and passion at one platform. And I guess, you know what, we should be calling upon developers, join here and let's talk, because, we act like a leader, and that's what I want to do. So that's, I guess I'll get carried away, because we have to work with passion. I'm telling you, without passion, there's no solution to it. Without human values, there's no solution to it. This is going to go on forever, and yet there will never be a solution. Right. So let's work together as humans. Okay. Thank you.
Sounds good, Prab. So I just want to remind people, we've talked about housing. The idea is to move on to a different topic to cover all of them. So try and focus on homelessness in the next hour, but also be mindful that housing and homelessness and mental health and harm reduction, opioid crisis are all intertwined. And also Hava did ask the question that, what's the council going to do about, this plan of gentrification and how it's going to affect people. So we'll hear from Khalil next.
Khalil, you're muted or something. I think we can't hear you.
Khalil, we can't hear you yet. We can see you, but we can't hear you. You can work on your mic there. Next, we'll go to Eric and then Dana Lynn and Yvonne. So it's, when you get your mic figured out, Khalil, then we'll let you back.
Actually, Khalil, I saw you connect there.
Have you got it, Khalil?
Can you hear us?
Yeah.
Can you hear me now?
Go ahead.
There we go.
Okay. Thank you very much for the opportunity. It's important for all of us to learn from each other. And I think it's a good platform to invite all the people, candidates for councillors and mayor candidates, and also stakeholders and activists and people working with homelessness on the street, and healthcare providers and many others. And I agree with most of been said this tonight. It's I've been debating for the last couple of months, and some people think this what we're facing in London, it's just a challenge, and I believe it's a crisis. We're facing crisis of homelessness, crisis of housing, crisis of transportation, of safety. If we don't deal with them, it's gonna affect our growth and stability, and won't be able to compete among our cities around us. And so that's very important when we talk about affordable homes. We talk about truly affordable homes. We're not talking about just the 80% market price. It's not affordable, because so many people work on minimum wage. If you work on a minimum wage, you'll be able to make only $2,480 per month before you pay taxes. When you pay taxes, you'll be left with probably $1,800. And the average homes in the city of London between $1,500 to $1,600, $1,700 per month. So nothing left to eat or to do anything. So therefore, I believe we have to build truly affordable homes. And I know the city last week announced a few hundreds of them on the Soho area. Today, I got the chance to meet with Citizens St. Joseph, who are participants in this project, and also the Italian project. They told me how much they have suffered for months and years to get the license to build those homes. So we have to be able to eliminate the red tapes and also work with the province to speed up the process, because we are truly in a crisis of affordability and a crisis of home. As you mentioned, Jeff, a few minutes ago, we have between 5,000 to 6,000 people on the waiting list, and the waiting list sometimes takes 10 years in order to get one affordable home. Yesterday, I was canvassing in somewhere in London, and a lady, said, "How you can help me?" And I said, "Tell me what you want." Said, "I have a cancer, and I cannot work anymore, and I will be evicted. I'll be homeless soon if we don't get affordable homes." And many people, in the city of London will be homeless if we don't offer them a good affordable home, truly affordable home. And that's very important. And also, many people talk about the homeless issue. The homeless issue is serious stuff. I listened to many different speakers before me, and yes, I agree with you. We have to address this issue carefully. And I propose in my platform to hire 50 new frontline homeless service workers who are specialized in this area to assist us to have, streamline the homeless issue and deal with it once for all, and to open, 2 transitional homes, especially before winter, immediately, in order to house the unhoused people and give them the shelter they need and the food they need and the respect they need. And I think it's important for all of us from the human aspect, also from the economical aspect. Today, I had a, interview with the CBC. Before I went to the CBC, a lot of people were sleeping on the street about 7:30 in the morning. I felt so bad because very cold, and it's sad. We live in a sad situation, and I agree with the speaker too. So we cannot do it alone. I'm not the totally expert, even though I work in Woodstock with the people with physical and mental challenges. But still, we have to depend on the people who've been working on this file for many years in the city of London, like Forgotten 519, like Unity Project, Sanctuary London, Project Hope, and London Cares. All those groups who have more expertise than me and many others, and to help us to put the platform that we need in order to solve the homeless issue. And at the present time, some people ask me how we can pay for it, and was public knowledge right now. The City of London given $2 million tax break to landlord in downtown to keep the downtowns empty and closed, boarded up, and so many different places in downtown not open. We have 35% from the total land businesses in downtowns closed. We can utilize those buildings to house the unhoused people, and we can use them to be affordable homes, because the probably won't be needed in the future, because after COVID, our life, our business has changed totally. A lot of people working from home, so we have to be creative about it. And also, we want a city working with all the pillars of the City of London. We want a city working with the education institution, work with the hospital institute, the health institution, working with the business institution to put plans for the future. At the present time, we don't talk to each other. For instance, Fanshawe College attracted 14,000 students this year. Western University attracted 5,000. We have 19,000 extra students came to the City of London. We never thought, they never planned how we can house those people, how we can bus those people. You have a administration voted down the most important element of our society to move people around, the transit system. So now we have a half transit system. And in the meantime, other cities like Hamilton, like Kitchener-Waterloo, they benefited from the COVID era, which most of the business was closed, was a quiet time to build their transit system. What we did, we voted against it. We didn't vote for it. And now we're talking about another debate, how we're going to deal with it. So we have 6 years debating and talking. Until now, we don't have a plan for transit. We're talking about building another 50,000 units for the City of London for the next 10 years. But how we thought how we can move people around? No. Did we talk to the hospital? No. Did we talk to Fanshawe College? No. Did we talk to University of Western Ontario? No.
Khalil, I appreciate what you've said, but can you summarize and let a couple more people speak?
Yes, I would say we have to have concrete solutions for homelessness. It's a very important issue. We have to utilize the people who work in the street, not the bureaucrats. And also, we have to deal with affordabilities. We have to build more affordable homes to house the people. And a third very important element, which is the transportation to move people around.
Okay, thanks so much, Khalil. I read in the news that people are considering medically assisted dying because they can't afford to live. They're suffering with disabilities. OW and ODSP are paltry sum. They're not enough to live on. So people are actually electing to end their lives because they don't want to go on suffering and not being able to afford rent and live on the streets. So things are just awful for people. Also, I remind people about Haba's question that wasn't answered about gentrification. So we'll go back to the next person is Eric. Thanks so much for waiting, Eric.
Thanks a lot. I just want to thank you for inviting trustees actually to this, because sometimes we're left out of these kind of town halls and events during the election, but actually the Thames Valley Board, I think, has a huge role to play in these issues. And so I'm really grateful for the opportunity to talk about that a little bit. I am running for a trustee in Ward 7, 8, 9, 10, and 13, so downtown, and then basically the entire west end of London. What got me interested is directly related to what we're talking to tonight. I represent a lot of legal aid clients. I'm a family lawyer and a CAS lawyer and an Office of the Children's lawyer. So I represent a lot of legal aid clients who are desperate not to lose their children to CAS, which, as you probably know, comes hand in hand with poverty a lot of the time. You get CAS workers coming in and saying, well, there's no food in the house. So what's the solution to that? Maybe we'll support them. Maybe we'll take the kids away. We take the kids away, you lose your Canada Child Benefit. You lose your subsidized housing. It just gets worse and worse and worse for them. As an OCL lawyer, I work with kids who are on the ASD spectrum who are being kicked out of school because there's no supports that they need. We don't have enough EAs, we don't have enough SSPs in the schools. And so these kids who need more support, one classic example is the autistic students who will ask questions. Turn to page 67. Why 67? It's not because he's being difficult, because he's actually asking. That's just how it presents in a lot of kids. And so they're sort of labeled as combative, and they're not supported. They end up kicked out of school. They don't graduate. And where does that go? I think I'm probably not alone in having heard about the issues around B. Davis industry when that hit the London Free Press. And so over the last few months, I've really been fortunate to connect with a lot of students and parents who are directly involved in that school or who have been directly involved in that school. And one of the things that I would prioritize and that I would love to see the board prioritize, because I'm just running to be one vote or one voice of 12, is making sure that this de-streaming push that the province has implemented doesn't mean that we take away opportunities for kids who may not be college bound or university bound to explore other training. I was talking to a guy earlier this weekend on a construction crew who was telling me his wife is a teacher. And he's telling me that, they have a huge shortage. We all know there's a huge shortage of skilled tradespeople, construction workers. So I actually grew up in Ottawa. Back at the Ottawa board, they had a program where kids could get involved with local developers and earn high school credits by actually going and learning roofing and things like that. And we've got this epidemic in Thames Valley of the board looking at OSSD, so high school diploma outcomes, looking at how many kids are going to college, how many kids are going to university. And I think we have an issue where administration is going, well, if you're not doing any of those things, we can't help you. When there are lots of ways that the public education system can set kids up to have successful adult careers. So how is that relevant to what we're talking about tonight? Well, how many kids that I walk by on Dundas every time I come to this office in the morning could have had more support at school? I mean, it's not always that simple, but there's a lot of kids out there who, for whatever reason, didn't finish high school, didn't get through high school, and were left with literally no practical skills, no way to support themselves. Maybe they're coming from a difficult family situation, but then they're not being given a way to deal with that as adults when they turn 18. These are things that the board can really help with. When Indy was talking about social determinants of health, and she was talking about, let's go back to the beginning and make sure that we actually address the root of the problem, the public school system has a huge role to play in that. Just finally, I know I don't want to take up too much time, but I was also contacted this morning by a lady who has a really strong interest in anti-human trafficking policy. And that's another way the school board can really get involved in protecting and sort of being an early warning system. last year, the province mandated school boards to create their own local anti-human trafficking frameworks. And it's actually, it's called Policy Program Memo 166. But basically what they did is they said, every school board has to figure out what are we going to do when kids are at risk for human trafficking, when they're going through human trafficking, because we know a lot of people who are involved in this system know that a lot of kids who are, again, out there on Dundas are actually actively being trafficked. I mean, it's awful what's going on out there on our streets right now as we speak. I watched a kid die just a block away from my office a year ago this past winter after sleeping on a grate for 3 or 4 months. It was awful. It's happening right now. But our board's policy here in Thames Valley has a whole section called Strategies to Raise Awareness and Prevent Trafficking. It talks about awareness raising initiatives for students and awareness raising initiatives for parents and caregivers. Missing is awareness raising initiatives for teachers. And they have a huge role to play in recognizing and seeing when these things are happening, when kids are at risk, when they're about to be the next kid living on Dundas. So I want to see that totally overhauled. And then just finally, you know, Jenna was talking about, look, a lot of you candidates don't really know what you're talking about on this. Reach out to the people out there on the front line. So I'm really, again, just grateful to have been invited to this because I'm learning a lot. And I just want to say that I'm open to any ideas, any thoughts, any way that, you know, the school board can help with these things. I think there's lots of ways, and I'm really open to trying to connect the Thames Valley board with all of you. So thank you again.
Sharon Debra.
I think I'm up next before Dana Lynn.
Yeah.
I'm Sharon and I'm a candidate in Ward 7, and I spoke briefly with Jeff today on this housing crisis because about a year ago I've been involved in Needham Funeral Services, and I can say the majority of the bodies that are picked up are in their 20s and young people, and I constantly ask myself, what is it that we missed that we couldn't help these people? I'm also going down to London Mission Services to do free haircuts for people. And so I am new to the London environment because I've moved from Toronto, and a lot of people don't want me to even discuss my experience or what I bring from Toronto. But there's a lot to be learned from Toronto. I heard the discussion about zoning, and Toronto is actually, they have done their zoning where they use retrofit shipping containers as houses. They have shopping malls, and Blue Bay is using it as cottage country. So I'm not sure why London is taking until 2023 to figure out what zoning is. Amending the bylaw should not take a year. So there are a number of things that we can do as people here in London as residents, and I believe in community service. I'm willing to learn. I'm willing to get out on the street with Jenna Rose and whoever is out there and experience it so I can make better decisions. And one of the things that the city of Richmond Hill is doing is the longest night of the year, which is I believe the 23rd of December. Politicians are invited to go out and sleep on the street with a sleeping bag to experience what the coldest, longest night of the year feels like. You know, you want to sign up to do this job and you don't believe in community service, well, shame on you. Over to Dana Lynn.
Yeah, go ahead, Dana Lynn, sorry.
Ani Bonjour, Indigenous Guys, Dana Lynn Williams, Dodom Ginajo. I just want to say to you that I'm running in this election as a First Nation candidate. And I've lived on reserves up until I was 20. I got into policing and I went on to reserves in the north. And, you know, I really have felt the bitterness and dislike from a lot of, and I'm going to say it, you white people out there, because you think you have all the answers and you want to speak for us, and shame on you. Let us have a voice. And I'll tell you why. I've gone down several times to the people on the streets. I've interviewed them, I talked to them. A lot of them are wonderful people. They've have some abuse problems. Many come from trauma, and you ask yourself, well, what kind of trauma could a 20-year-old have? Well, a lot of these people have watched their mothers and fathers, their fathers abuse their mothers, their grandparents, be in situations where they're intoxicated. We need to find these individuals' homes. And shame on you, Michael, too, Van Olst, because you know what? You guys have sat for 4 years now and not done a thing for the individuals on the streets. And as I was scrolling through this, I don't see our so-called individual who's coming up and running for mayor. I don't see Josh Morgan here. I don't see the gentleman. There's just a lot of individuals are not here. So that tells you a lot. That tells you that they don't care. That no, they don't have the compassion that's needed to be in a position. And you know what? I think it's time that London starts to look at individuals in a situation and we start to stop looking at a superiority of individuals who sit in council, and we start to look at minorities and putting people in place. Maybe Prob Gill has the answers. I was just at the temple yesterday, treated like gold. And maybe that's what we need. Maybe we need some new faces in council right now that have compassion. I've worked on reserves where I've watched 5-year-olds drink shoe polish, where I've watched them sniff glue, little 7-year-olds. And I watch these people on the streets. They're hurting. They need a place to live. One of the things that they say to me is, give me my dignity. Let me have a house. Let me have a little place that I can call my own. And that's all they're asking for. And if we can find that area to give them that little place that they call their own, where they can go back to, and we don't judge them as individuals. Yes, some of them are intoxicated, they're on drugs. Yes, but they're doing that because they're doing it for a reason. They're not, and maybe we can offer them the services through social systems that help them relieve those problems and relieve those stresses. And so, you know, I'd like to see a new council in there. I'd like to see a new council that has compassion. And that's the word that we need, compassion. Thank you.
Well said, Dana Lynn. What ward are you running in?
I'm running in Ward 14. And, you know, we have an issue in our area. I know that one of our London housing areas is going to be shut down. And you know, one of the ladies when I was campaigning, she's like, you know, we've never had a candidate come in here because they don't even consider us because we're poor. And I said, no, I consider you because, you know, my grandma was poor, my mom, and, you know, she didn't come from the best of home. And, you know, I look at her and I think, your vote counts. She said, I will be out to vote. And the thing is she's scared. She doesn't know where they're going to go. They're talking about building a 6-story apartment building in the area. And she said that they have to fill out applications and she doesn't know if her family will qualify. So this is what we're faced with. This is what is taking place. And it makes me very emotional because no person should have to worry about where they're going to live. And, you know, our city council, I watch them and they don't have any compassion. And, you know, it's great that they make a great wage and everything, but like, come on, guys, you know, you got human beings out there. Yes, they have some issues, but, you know, they need help. And I think that's when we start to offer them help, we'll see things change in London, Ontario.
Absolutely, Dana Lynn. Thanks for your bringing your passion and commitment. We'll just go to Yvonne and then Penny and Diane, and then we'll try and hear from Healthcare is Voting. Go ahead, Yvonne Spicer. And just a reminder, 8 o'clock, we should start talking about harm reduction to stay on track. If any people are on the front lines of harm reduction, please put up your hand and we'll hear from, go ahead, Yvonne.
Well, okay. Well, thank you for letting me come and thank you, Jeff, for sending me the information tonight. So a lot of this information resonates with me and my mom. Housing. Good luck. Being on ODSP. Screw it. It's right now to the point that where it doesn't even matter where you go for housing, ODSP, any of the other topics you're talking about. Good luck, because right now it's useless. Useless living in Ontario, because it is one of the countries that is so expensive that to live here, no matter what. Right now, oh, you want me to start my video? Okay, sorry. Okay. My mom and I both live here in London, Ontario. And right now, we're renting a house. And right now, the cost for our rent keeps climbing. My mom is on low income for old age, and I'm on ODSP. Well, right now, 5%, not enough, especially with housing prices, groceries, and bills, and everything else going up here in London. That just to find another place for us that's affordable is not enough. Right now, especially ODSP, we're trying. Yes, Doug Ford. He's useless. And 5% is useless because when you go to the other candidates that ran this year, they said they were going to double it. Well, didn't happen. And right now, like you're saying about housing, you're talking about ODSP, you're talking about a couple other things. Well, we live it every day, and we don't know what else to do. So I am an advocate who advocates for across Canada and Ontario. And I've been doing that work to help you guys all the time. And yes, some of you guys on council, my mom and I sometimes watch it on the channel for London to watch city council. What you're doing is not making any difference. You guys really need, I don't know why you even put your name forward if you're not going to do your job. I have ran for elections before and I keep my word. When I say I'm going to help people for certain things, I do it. Well, city council, why are you running in the first place if you're not going to keep your word? Eric, I love you. You are doing a good job helping people who are on ODSP that have a disability and keep their children. CAS, they're useless because what they're doing, they put kids up for adoption for $5,000 to send them to rich families. And I've got someone who has an insider info on that, and that's wrong. So I would love to work together with you guys to make changes here in London. I go to every day, I'm out seeing different things, people panhandling, saying, I need money. I can't live like this. I'm living on the street. I can't have don't know what else to do. And we're in a state of emergency right now in Ontario for different things. You want to say anything, Mom? Okay. So I would welcome advice, some options here, and I would like to work together with all of you. And if you're hiring, put me up. I'm put my name up because I'm hiring. I'm applying for a job. Thank you.
Thanks so much, Yvonne. And we'll hear from Penny, Diana, Colleen, and then healthcare. Sorry, I just want to hear from Colleen because she hasn't spoken yet. So go ahead, Penny.
Hi, I'm Penny. I live in London. I won the homelessness, ODSP. The one thing we need to do is build more co-ops. When Mike Harris was in, he canceled all the new co-op bills. Also, there is lots of land in London that is vacant that can be used for co-ops and for other buildings. Also, with the healthcare, the mental health care, the CMHA be revamped and that sort of thing. They need to be integrated with the hospital. I had a call from CMHA today, and I was being referred to them several times by the hospital and my family doctor, and I got told today they're not going to help me. They don't do counseling. They're not going to help me with my post-traumatic stress disorder and depression. But we need all governments to talk to the people, listen
Khalil,
to.
Sorry, Penny. Khalil, can you mute yourself? But we're just hearing like a ringing. Go ahead, Penny.
We need all governments to work together. We need all governments to talk to the people that are involved. The homelessness, the ODSP, the OW. We're the ones living it. And we need help. Sorry, Jeff.
That's okay, Penny. I'm really sorry you have to go through
just
this.
after 5 years of trying to get help and get told we're not going to help you.
Thanks so much, Penny. I know you've been really struggling and not being heard a lot by the system. So I'm sorry you have to go through that. Thanks for sharing. So I wonder if there's anybody who wants to speak to harm reduction. We should be starting that now, but we're going to just catch up hearing from Diane and Colleen, and then healthcare. Go ahead, Diane.
Okay, well, I kind of have another question for everybody that's been on council and whatnot for the past number of years. I know when you look at the city's budgets of other cities, they always have like an emergency reserve fund for various different things, but apparently London doesn't, which could explain why we have so many problems in other areas of funding. And I'm just curious to know why London doesn't have any sort of an emergency reserve fund, and where is that money going that should be being put set aside for emergency reserve funds? You're muted, Jeff.
I think it was Colleen that wanted to speak next. So Colleen, did you want to speak to Diane's and also whatever else you wanted to just speak about? You'll have to unmute yourself.
Yeah, I do believe actually that the city does have an emergency fund. What we need to see is why are we not allocating that when we are clearly seeing some emergencies in our city. I am running for Ward 4 City Councillor. I have spent some time working at a Housing First program. So when we're talking about these issues, I do have a little bit of knowledge about what is going on in the system. I think that the city needs to leverage federal funding to invest in rent geared income housing, because we've heard from a number of people across the table who are saying you're getting more and more worried about how you're going to pay your rent going forward. When landlords have control of that, we don't have control of that. So when the city has more rent geared to income housing, and we've talked about the lengthy list of people who are waiting desperately for that housing, we need to make those investments. So we need to call upon the federal government who has stated that this is that housing is a human right, and get those federal dollars for those programs. We have seen some successes in this city in helping people be housed. There is, and it was slow coming, but we're finally seeing some movement forward with the 680 units that will be built in Soho, and I think that's a fantastic program. We need to continue to follow that leadership. We've seen in Calgary where they've retrofitted a building in downtown Calgary that used to be businesses, so we need to start retrofitting some of our businesses into apartment buildings with a 1% vacancy rate. We need housing across the board. So that is so important. And I really liked what Jenna Rose said about our increasing police budgets. The problem is we keep trying to put on a roof when it's actually the basement that is flooding. So we need to be providing the supports to make sure we're addressing those pillars of health, that we're addressing poverty, because of those things will lead to that. When we're seeing the crimes that are happening, they're crimes of poverty most often, and those people are just being returned back into the system, back into homelessness, because that's not the answer. The answer is providing the services to shore up that basement in the first place. So I think we need to be looking at how do we do that, and that is by actually funding our frontline workers properly. As Jenna Rose said, we're seeing some burnout because it is horrible to be asked every single day for housing, and no, we don't have an option other than offering some of those things. So we, as she said, you know, the sleeping bags. So we need to be looking at how can we retrofit some buildings quickly, and what do we define as an emergency? So there's a really good book, and it's actually addressing the climate emergency, but it talks about a good war. And so when we went into World War II, we utilized things so quickly and changed things so quickly to address that war. We need to have that same mindset of utilizing buildings that we have in existence. How fast can we retrofit them? Having agencies work together to make sure those decisions are being made quicker, and we're bringing those buildings on board faster so that people have a place to live. That is what I wanted to just say in regards to some of those issues. Because, and another thing I would like to mention, because somebody mentioned the COB benefit, which is actually provided both through the Canadian and provincial fundings. But what we also need to look at when we're representatives is the loops we make people who are living in poverty jump through. So when I have a mortgage, it's 5 years before I have to readdress that. People living in London Middlesex housing have to provide their forms year after year after year, even if it's pretty obvious that those things will not be changing. And oftentimes we penalize them, not because they are no longer in the same financial situation, but because they didn't have the capacity to get that paperwork in on time. So we need to be looking at, are we providing counseling or services on site to help make sure if we're saying that paperwork needs to be done, that people are helping them get that paperwork done. So we're not putting people out of their housing, not because they no longer are able to have that housing or it's applicable that they should have that housing, but because they didn't fill out a form properly. So I think that's something we can address really easily. And again, that affects people's mental health when you're constantly worrying about, am I going to maintain this housing? So that's what I would like to say.
Thanks so much. Thanks for sharing. So I just want to note to people that in 2009, we bailed out the banks for 120 billion through the Canadian Mortgage Housing Corporation. We're not even sure where the money went. Was it paid back? Did it get forgiven? If it was paid back, then let's bail out the country and build housing with 120 billion all across and use public banks for that. But just going to hear from healthcare, and then we need to talk about harm reduction and that aspect of things. Go ahead, healthcare. Healthcare is voting. Maybe you just haven't taken down your hand yet. So just maybe.
Okay, I just had to. I lost the screen. Okay, so so some of the stuff I've heard, and some of the stuff I'm going to tie into harm reduction. If you look back on all this, we have a lot of statistics, and we got information coming and going, and these statistics are only biased. They're on a persistent train of thought, a theory. And this all comes back to policies that have been implemented from a federal level, from a provincial level, and they affect the municipalities, which are the cities. So in hindsight, the Housing First policy is what has been dealt with for many years back in the conservative era. and the cutting of all the building of housing, any new affordable housing or not-for-profit, rent-a-gear, co-op. And we also changed rent control too, which made the rental increases happen. So landlords have been sick and tired of people damaging their properties, rightly so. They're tired of the housing first policies, and they don't want to get involved with cities because there are problematic people in the buildings damaging what they don't respect. And those people are given housing first policy, but they're not even ready to live alone. And you think you're giving them a wraparound support, but that's not what they need. And they're not being the people that are. We're paying more money for administration of passing people through a system than we are actually focusing on building housing that's going to be more supportive, like Indwell. There's many different ways to go about it, and there's many different policies we need to change at many different levels. But this policy of housing first, which is taught to every city, has been, and he does profit from this. He does. Ian Dion, he is a European white person that says he has worked on the streets of Toronto, and he implemented the Toronto Shelter Program or the Housing First Program. And he comes about and teaches the cities how to run this program. And he tweaks it every once in a while because somebody else has given him a little run for his competition. Because it's competition. It all comes down to competition in this society. And everybody's competing for a set amount of funds and trying to figure out what is going to be the best impact. But sometimes the impact does have nothing to do with outcomes, right? Because it totally is flawed. So we have to look at the harm reduction as a basic tenet, which is that people cannot be sleeping outside. You cannot be okay with yourself every night with people sleeping outside, especially in the winter. I've seen people frostbitten. They're black. Their fingertips are black. They're red. They've had them amputated. Their legs amputated. Like, I saved a guy from having an amputation. He had the flesh-eating disease. Oh my God. I've heard a few stories about it too, and I've seen the aftermath, but he had 2 legs that were saved. Nobody wanted to even go near him in the healthcare system or the outreach system. And believe me, it's not pleasant smelling, but you have an outcome. Your outcome is to save a person's life. That's the only outcome. And you grind down and you bear the smell of it. And anyway, I have curiosity, so I'm okay with it. So anyway, accessing with another nurse that's very high on the homeless issue, and he teaches at the university now. And he has experience with the homeless population. He's not like preaching something he doesn't know nothing about. So anyway, he did recover, and he did do his transition into the community, and he went into a transitional home, and he was hospitalized for a long time. We don't see the cost of these people are ending up in a hospitalization, and you don't even realize how much it costs for a hospitalization. Like, it costs thousands and thousands of dollars a day for some of these interventions that could have been avoided, and they're not. They have to be in wheelchairs and what have you, and they could be on a prosthesis or whatever, but that takes time and rehabilitation and all that. So by avoiding all this collateral damage, and if we just look at some of the policies, and we have to look at the policies from the municipal level to reduce harm, and not just harm from being out in the cold, but harm in other areas, right? Harm reduction is very broad, and it's not just a drug addiction. Oh, we don't want to get them have HIV or Hep C, and we don't want them to overdose, so we give them Suboxone, and Suboxone is a more efficient drug to use for fentanyl overdosing and that kind of stuff. It's a very broad look and expansion. You have to have the mind for it. So I think we really have to go back down to policies and looking at how do we change policies, both at municipal level, because they look after the shelters, and people could be getting into detox, but detox is run by the Salvation Army, so check yourself on your privilege there, because if you go to Hamilton, you get a detox in a hospital. Hospital run detox with nurses that treat you well. You go to Toronto, your detox for women only is a hospital, right? So it's the policies of different agencies and that whole theory of deinstitutionalization, which hospitals is more expensive and community-based services are cheaper. Well, you get what you pay for too. So usually they have higher standards on who they hire in a hospital with the BSW or whatever. So they pay a little better, but they usually have staff that stay there longer. So they kind of know what they're doing. They kind of get good outcomes at discharge management. It's a whole different theory, right? And you've got people in these community-based agencies that are not even masters at anything, and they don't even have that total background of what they're administrating. So you have these flaws coming into these systems, and it's just making a mess of the streets and the community at large. And I really think all humans need to have a place to live, whether they want to be in a transitional home or a supportive home or a group home or an individual space.
Can
And
you
I think
summarize
landlords,
healthcare, and we'll talk some more, hear from somebody on the harm reduction side?
and I think the landlords need to take more active approach to looking after their properties, right? And we need to have that rent TO thing in place. Landlords will increase the rent to dissuade people and get good tenants, but not good tenants that can afford the rent are not always the best tenants. So there's that whole business perspective of being a landlord, right? And I think there's some room in there for them to put in some low income tenants that are good tenants or be affordable tenants, based on their income. I think
let's go to
we
Jenna
need to
Rose.
look at that business. We have to look at the business model for landlords to implement mixed income properties, right?
Okay, thanks so much, healthcare. We're going to hear from Jenna Rose. Thank you for sharing.
Yeah.
Go ahead, Jenna. I remember one of the doctors saying that London gives out as many needles as Toronto does, and if we could save money if we just housed people. But go ahead, Jenna.
I mean, yeah, talking about harm reduction, people don't like harm reduction because it's people still using substances and drugs. People are going to use substances and drugs after a hard day. How many folks go and crack a beer or have a glass of wine? That's something to help, temper it down. When you're not housed and you have nothing and the city is constantly moving you and taking your items and this and that, the people come to substances for a variety of reasons. People also come to substance addiction from, under the care of their doctor. If they get sick or they have an injury and suddenly they're taking medication and now they are addicted to it. Harm reduction is all around us. Seatbelts are harm reduction. I don't drive because I have a medical condition. That's harm reduction for me and everyone else on the road. So it is important, we're just mitigating harm. And I think taking an abstinence base on anything is ridiculous. When we at Safe Space, we help and support sex workers. Sex work is never going anywhere. The industry is booming. It's becoming more mainstream. We reduce harm to workers. We safety plan with workers. We educate people on, the needs and barriers of sex workers. And so it's with everything, unfortunately, I don't think prisons are ever going to go anywhere, but that doesn't mean we're not advocating for things to be better in the justice system to not be better. The same is for harm reduction. We need education. We have to understand that drug users are people, valid people who deserve respect and dignity. And on that note, if people wanted to leave, I don't know if you folks know, but a lot of times if you go into detox, you actually can't enter into detox without seeing a medical professional before. If you are detoxing off of alcohol, you have to see a medical professional. They will not take you until you get a prescription to help mitigate the withdrawal, because the withdrawal can kill you. So, I mean, right now, think about it. One, there's 5 detox beds for all of London for like women. Like it's like 1 floor in the Sally. So in Sally is faith-based, which a lot of people like. Faith is difficult, especially for BIPOC people. You know, I don't know about you, but I feel like if I go into church, I'll probably burn. I'm Indigenous. My family has been like decimated by residential schools, a 60s scoop, and Indian day school, all close, like immediately within my family. The church is not for me. This is many people. Many people have complicated relationships with faith, so that the only detox in a city like the size of London is only like what, 5, maybe 10 beds top is ridiculous. So you get somebody, and this has happened to me. I have had somebody where I have been like, okay, I will take you to detox. I will call, and they're like, you need to take this person to go get a script because they could possibly die. Okay, I go to the hospital. They tell me I'm going to wait about 12 hours. Try being with someone who's actively in withdrawal and you're just waiting for a script for 12 hours. I actually was crying in the hallway of Victoria Hospital. The nurses and doctors saw me and I said, this person has a bed. All they need is a script. They're actually willing to go. And they took pity on me and gave me the script. If they did not, this person would have left. They would have been gone. You know, they would not have made it through. My 4 hours there was a flip-flop as a person going through a draw of like, I love you, I fucking hate you. Sorry, oh my God. I love you, I hate you, sorry. But you know, see, it's like the wait times just preclude that from actually happening. The fact that our detox is only in a faith-based organization, the fact that we don't even have enough stabilization spaces for people, like how can you even talk about changing anything or fixing anything when we literally don't even have the bare basics? How can you talk about affordable housing when there is actually nowhere for people to spend overnight? Like, how do you talk about getting people in out of active addictions and into these programs when you can't actually detox them off of the substance? Like, there's nowhere for them to go. So like, why even build these ideas? Like, we're going to do this, mental health supports. If someone is in active addiction, chances are they're not going to make their weekly therapy appointment or group therapy appointment. So you know what? It's never going to change. So harm reduction, until we fix the problem, the hot mess that is the problem, harm reduction is the only way to go and should be supported across the board. Because you know what? Abstinence isn't going to happen. Think about something you do very regularly. And are you happy when you abstain from it? Probably not. So why are we going to be like, oh yeah, okay, people, it's just easy peasy. Just don't do drugs, don't drink. And then your life will be better and you'll magically get a home that we don't have. You'll be piss poor, you know? So like, we're not up here and building and creating all these things. We're literally at the bottom. There's no spaces. One, get spaces. Then maybe choose the next step. What is the next step after actually having spaces for detox? Maybe it's stabilization spaces. After that, maybe group therapy and wraparound support. But we're like jumping all over the place. If someone wanted to detox right here in front of me, I'd be like, I'm sorry. I hope you have another hit or another, you know, because there's nowhere for you to go. So harm reduction has to be a part of it. And even if we did have all these spaces, harm reduction has to be a part of it anyway. Abstinence doesn't work. So, yeah.
Anything else you wanted to add, Jenna Rose, or?
No, I mean, it's like I think we're all like talking top up when we need to be talking bottom up about these things. And, you know, we're talking about city council and this and that. And one thing we found out in the 519 was that city council actually has no idea what's happening in like the real world. So, you know, Maureen Cassidy and Stephen Turner went on to the CBC and were defending these lockers. They were like, oh, the lockers exist. We take people's items and we lock them and we give them a ticket. And this, I was like, no, they don't. But they were told that. They like totally defended that. that these existed, and they actually didn't. I was like, okay, go find them. And we had people that were like, okay, we're gonna go see if we can get to them. One person, after 2 days, a goose chase, ended up in front of a storage locker, and the guy was like, yeah, so like the city tells people that like stuff like there's nothing here. The city doesn't have anything. We get people here like pretty frequently. They just don't exist. Yeah, like the storage lockers were waste management trucks. So like that's what they were told, though. They were told that they existed. So, with the rent safe program, I'm sure, Michael, you were told that this is a terrible idea and these are the problems, da da da. I truly doubt how far you went and looked into that or anything else. You were given information, you were given a piece of paper, you looked at some quick stats, and you were like, no. Because if it's anything like how it was with the front line and stuff like that, you don't know what's up. Yeah, and that's why part of city council came out on outreach with us. And I said, if you don't believe me, I'll take you to the river and you can talk to people who want to talk to you and you can hear it for yourself. That's how big the disconnect was. So, I really do doubt when they're like, oh, we did this, we looked at this and we weighed the stats, and, just be realistic about that when it comes to the incumbents coming on. Like, they're going to defend hard the decisions they made, but they were made based on information that was fed to them, So after we took people out on outreach and talked to them, like counselors were like, whoa, we actually have no idea what's going on, because they were told it was fine, that everything was okay, everything's peachy keen, and we were just loud rebel rousers who wanted to cause a stink. So
how do we improve communication? Get counselors to go on a walk with you?
I mean, just vote for counselors who are already active in their community, already doing the work, not just being like, oh, I'm running for council, I guess I better go sign up and clean up the river or walk around. Like, look at people and vote for people that are active and that you've seen their politics in action, not just hearing for it for the first time. People that literally walk that walk and are connected, and also ones who are willing to be like, I don't know anything about that, so I'm gonna seek out that information. And I think that's important, like knowing where to go and where to ask for information, and not just believing what like comes through on their desk at City Hall. Like, practice critical thinking. You're working in the system. Why don't you like get some outside input from outside the system? So
Well said.
that's what I'm looking for personally, is people who can think and who aren't just going to keep a really, really crappy status quo.
Thanks for being so candid.
Yeah, thanks for having me here.
It's a privilege and a pleasure.
Yeah. Let me say, Jen is correct. There's a lot of tail wagging the dog at City Hall, and so I'll leave it at that.
Okay, thanks, Michael. Dana Lynn, go ahead.
Yeah, I agree with Jenna. We need some real people in there who have watched and have, I guess, really don't live in these, glass homes and think that they just don't. They've never experienced things in their lives, and it's great that you read a book about the hurts of people, but unless you've experienced it, you don't understand what these people are going through. And she's totally right. I had one gentleman tell me on the street one day, he's like, what if I don't want to quit drugs? I mean, what if I like them? I said, then we have to, we don't have to take you off drugs. If you like them and you're using them responsibly, then yeah, if that's something that you enjoy, then, but we do need to get you off the street and into a safe place. And he agreed with me. But, I think the thing is that, Michael says that the tail is wagging the dog. It's time that we start being leaders and stop letting that happen and start to, taking the lead and getting out and understanding what's going on around us. We can continue to put our blinders on and pretend we live in a world that is all rosy, but it's not that way. And I think it's time for us to vote in city councilors and that know how to deal with these issues. And maybe it's time for the others to step aside.
Thanks for sharing, Dana-Lynn. We'll hear from Prob and then Ashton, Yvonne, Alex. Go ahead, Prob.
Well, thank you, Jeff. So back to the same thing, you know, we're here as leaders, and our main, you know, our focus today is to get as many answers possible, and we're here to listen and learn. This is the main focus here today, instead of, you know, going back and forth on things that we should have done or being our dead horse. Let's work together as one team. So I'm going to go back to the harm reduction. So it's a two-part, you know, it's education, Jeff, and assumption. So folks who don't understand why harm reduction is necessary, tell you why. Harm reduction is basically a step towards healing. So I've been a sports nutritionist, and I read and did a lot of research on it. So the thing is, you know, in order to quit, you have to have that willingness in you. Are you going to reduce the quantity of it? It's a medical procedure, actually. We have to understand this is there's education, there's a medical prospect of it too, right? And that's what we lack, actually. There are folks out there who are assuming things because they're fortunate enough. You know, they have mentors, or may have the money, you know, or luxury homes or whatever it may be. These folks out there, they're marginalized, they're vulnerable. They need a mentor. You know, as much as, you know, we want them to willing, my question to every and each and one of them as leaders out there, are you willing to hold their hands and say, hey, listen, I'm willing to actually help you to quit. I'm willing to take you to that medical store or rehab center to help you. So I give you a prime example. As an humanitarian, I get a lot of calls like this, you know, and there was one person who was alcoholic. He wanted to quit, but he didn't have the heart. You know, I said to him, listen, you know what? I'll work with you. I'll quit with you. So he said to me, how are you going to quit with me? I said, man, I have beer once in a while. I'm going to quit that too. Get my point? You have to work as a team. You have to tell them, hey, listen, I'm here for you, right? We have to encourage life. If you don't encourage life, you know, you're not going to encourage them to reintegrate to society. We have to show them the light on the other side. We're not doing that. We're just assuming things. And I believe that, you know, we have to have that education and workshop much needed, specifically towards elected officials. You know what I mean? So they need to know how to actually use these tools. We have experts out there, you know, a lot of talented people who want to help. Let's include them into a process and work as a team. Thank you.
The Portugal, actually, Michael Moore did a movie where he looked at all the different places in the world who are the best at doing things. And I think it was Portugal that decided to criminalize all drugs and make it a medical issue. And it's you know, saved a lot of lives and helped people recover a lot. So I'm going to put a mental health first aid course link in the chat, just because it's a great course for people to take to help people. And thanks for that, Prob. And we'll go on to Ashton.
Hi, everyone. I'm Ashton. You might know me as an accessibility advocate here in London, also living below the poverty line in a London Middlesex community housing building. I have a disability. I am a woman of color. There's a lot of things I'd like to share. I'm going to talk about this from a lens of disability and specifically focus on ableism, because as I follow the campaign trail, I'm not hearing enough about ableism. when we talk about harm reduction, the biggest thing is that I find our candidates and platforms and even our community don't recognize the dignity of the human experience. So when it comes to people with disabilities, just following the election, we were talking about the labor shortage. It's National Disability Employment Awareness Month, yet London, its institutions, including educational institutions, are not willing to do the work to make sure that their workplaces, including the City of London, the Thames Valley District School Board, Western University, and others, to ensure that people with disabilities can participate in the workplace. Just having people with this, there's a lot of people with disabilities who are overqualified for many jobs, but due to ableism, like concerns about how their wheelchairs will navigate spaces, the fact that we've been dealing with issues with paratransit and yet still our council hasn't been able to address the long waiting lines, the fight that we have to get a ride. I live 5 minutes away from the university, yet I can't get a sustainable ride to get me to my classes. How am I supposed to advance in life or feel valued if I can't get to my community and be there? I've been looking for jobs. I saw jobs that I could easily do with my experience of working with the province, with the city, supporting members in my community. Yet, oh, you need a driver's license. I don't know why you need a driver's license to show up at work when, if our city was truly committed to transportation, I wouldn't have to fight so hard to get to point A to point B. Where's the dignity that the fact that I constantly support people with disabilities advocating to get onto transit, going to the LTC, going to their meetings, telling them the same stories over and over again. And what do they say? Oh, we can't do that. We don't have the capacity. I've spoken to many of the incumbents, many former members of the board who used to be city councilors. And what am I told? It's an LTC problem. Yet, when it comes to policing, all of a sudden the city can just jump in and do things. Why can't we do that same thing for people with disabilities who need to get to places? If you want to address poverty and inclusion, help people be a part of their communities, whether it's through work, education, and just basically getting to their medical appointments so that they don't end up being further disabled or having further issues. That's huge. Secondly, I do think that we need full-time city councilors because I'm tired of this part-time half-assed effort. I'm tired. I've said this to a politician recently because he DM'd me criticizing me for who I was going to vote for. And I said to him, I feel like I'm being disrespected as a Black disabled woman who lives below the poverty line, that my voice and vote don't count. I make open invitations to politicians all the time to come to where I live, to come see what I see every day, to come deal with the challenges that I face every day. Yet, rarely anybody shows up. I thank Sam for showing up. Thank you, Sam, for listening, taking pictures. I'm supposed to be meeting with Jeremy McCall, but I didn't see any of the London mayoral candidates come out. People think that London Middlesex Community Housing, just because they rebranded, they actually care about the community. Maybe some buildings are better than others, but at my building, it's known as Suicide Alley. People have been jumping from buildings. We've had somebody who is homeless who passed away just after Thanksgiving, just behind our buildings. Why wasn't it in the news? Things like this happen at my building all the time. I deal with domestic violence disputes next door to me to the point where I'm afraid to leave my unit. I've had to be a part of evictions thingies because of the amount of people that are coming in, threatening people with knives and guns. I've had people ask me for medications, any kind of things that they can get their hands on because they're desperate. We have people sneaking into the buildings because they have nowhere else to go. And the resources that I call, they don't pick up. And I feel guilty because I don't know what to do. I don't want to send someone back out in the cold. But at the same time, we can't have people defecating in our garbage rooms or attacking other residences or breaking into our mailboxes and taking the very few things that our families or our small communities give to us. So it's helpless, yet I'm being told that everything's hunky-dory. MAID, I'm glad that Jeff Hanks brought up MAID. I've been following that for quite a while, and it's getting a lot easier for people with disabilities to die. And it's not due to the disabilities, it's about the lack of opportunities we have in a country that has so much to give us. So when I'm told that, hey, like my family's from Jamaica, and that they came here to provide me a better life. And I was on that route, despite all the other things I had to go through to get here, dealing with gender-based violence, starvation and all those other things. But when I got disabled and I was told that there's the social safety net that can help me still achieve, I fought. I showed up at city council meetings. I've gone to protests. I've organized. And yet I'm told, Ashton, you're too young. You don't know any better. Ashton, you'd be great for the city, but no, we can't make sure that you get here on time. I stopped working with the Accessibility Advisory Committee because I was sitting there on for 4 years, but yet still I had to beg for rides to get to City Hall. How is our city supposed to do better by the people with disabilities if A, we're not willing to hire them, B, we don't even have a plan for accessible, affordable housing. Many people in the streets need accessible units. Here I am in my building having to fight. Well, I fought to get an accessible door just to our laundry room. I fought to get an accessible door on my door. I've taken people who are afraid of the healthcare system, who don't have access to social workers and the caseworkers who are too busy chasing after everybody else to support them. I've physically taken them to the emergency rooms or to meet doctors or people that can help them. I am not a social worker. I am living on the margins. I have so many doctors that I need to see myself, and I'm fighting against the healthcare system. I've been contemplating MAID, and I've been fighting that urge so hard because I know it's a way for the system to win, to say they killed off somebody else that they find that is not valuable. So I don't know, there's a lot that can be done, but I think when I watched the mayoral debate that happened at the Wolf Performance Center, I just watched it earlier today. There's a lot of talk about truth and reconciliation. Well, the truth is London can't change until it's willing to take ownership of its problems, acknowledge that there needs to be tough talks and hearts and doing the dirty work. There's a lot of money being wasted on. One of the things I can't stand is the community projects. Well, I understand the importance of having our community involved in like deciding where that money goes to better their communities, oftentimes as people living in privilege. And oftentimes I see disability projects being ignored for things that are just nice to have, whereas our community is missing a lot of needs to have. So there's a lot I have to say and a lot of solutions I'd like to see, but I'm at the point where I'm literally sick. I'm tired. I'm dealing with, pending surgeries and fighting for continued access to very expensive medications for my rare disease. And yet politicians are coming to me and say, I need to reach out to them. No, if you want my vote, you need to come to me, come to my community, show me that my life and the life of the members of my community matter, because I'm tired of seeing people die, tired of seeing people kicked out, tired of seeing people beaten and abused. I'm tired. My neighbor died of an overdose last summer. We were very close. But it's like people are dying in these buildings and we don't know that they're dying. They just disappear. So that's all I'm going to say for now.
Thanks for your courage. Thanks so much for sharing, Ashton. So things are pretty bad right now. Thanks, Ashton, for speaking truth. And I just hope there's something we can do to help. Yvonne, go ahead.
It's not me, it's my mom. It's a camera here. Mom. Hi. Go ahead. Hi. Hey, do something. You were talking, the lady was talking about the rental properties. We live in a rental property, and the lady was talking about raising the rent for people who don't look after the property. Is that right? Yes. Well, we live in a rental property, and the landlord, ever since we moved in this house, the landlord has done, we've had to go after the landlord to do things to fix his house, because when we moved in, no repairs were done. So why should you raise our rent when we're the ones that put the money out to fix the house, not the landlord? So why should you raise our rent?
good point. That seems pretty unjust if you're doing the work and
We are paying the money out to fix the rent. I mean, we are paying money out to fix after the house because the landlord says, oh, you don't need that fix. You don't need that fix. And we got a railing going up to the bedrooms. And the top of the railing, the screw is broken in half. And the landlord's husband came and he used a drink straw to fix the piece of metal that was loose. So that's unsafe.
absolutely.
And I told the landlord about that. And she said, well, we'll come someday and we'll let you know when. And we'll try and fix it. But I hope they don't try and fix it with a drink straw again because it's unsafe for me.
Our landlord is a cheap old bugger that does not know how to do things correctly. This person's from another country, and all she does is hire cheap labor to do cheap work. And they don't bother to do things correctly and do it right. And we're getting the bums rush with it, with our rent going up for nothing we didn't do.
Sorry to
And
hear.
she talked to somebody that told her about something went up last year. And she didn't know about it until somebody told her. Then she turned around, she raised her rent again.
Oh my goodness.
So, we're putting the damn bill to look after this rental house when the lender should be doing it.
Sorry to hear
So
that.
this city you had tonight talking about the rentals and the landlords. We should not be included in those people that are gonna raise their rent because they don't look after it. We should be not included.
Okay, thanks for making that point. That's important as well.
Can you fix it? Is there
well-
anybody that you can help us with?
We can just try and ask the city to try and implement some kind of program that people aren't having their rent raised and they're not paying for their own.
The landlord are not
yeah.
paying money out. They're
Yeah,
taking
so-
us for granted, and the landlord got us paying the damn bill because we had a deck where the woods were unsafe, and the landlord didn't seem to take it serious.
I think that's a big problem, and landlords, I think they've tried to keep them accountable, but we haven't been able to win that with council yet. So thanks for that, and we'll try and bring that forward as well. We're going to hear from Alex next, and then we need to talk about healthcare.
So now I have.
Okay, so we'll hear.
Thank you. I just want to introduce myself. My name is Alex Hames, and I am running for City Council in Ward 13 for downtown. I am a nonpartisan candidate, so I am not looking for any political gain. I'm just an individual citizen looking to fill this citizen role of listening to our concerns and advocating hopefully for some solutions. I do have a background as a developmental social worker, so I've seen definitely our firsthand lack of infrastructure, lack of healthcare, and overall the need that is within our community. I'm not going to say I have all the answers, but I've definitely been working with our city for the past 4 years as a volunteer on the Animal and Tree Advisory Committee. And I've seen how long some of these programs have been taking. I've been working very close on the Green Bin Initiative, and it's taken over 4 years. And that's definitely something that could have been rolled out within 1 year. I know finding funding and other partnerships within our private and nonprofit sector is definitely something I'm interested in advocating for. Being from the developmental sectors, I'm just very passionate in that industry. If elected, I would definitely encourage more mixed use zoning, definitely in regards to the affordable housing. I want to create more walkable neighborhoods and definitely not put pressure on specifically having just geared to income housing, but also having affordable housing mixed in with our development too. So sorry. I want to answer most of the questions without trying to take up too much time, but there is so many of them. I'm kind of should have went with the beginning. Yeah, so definitely advocating for that. Because I am a DSW by trade, I am against institutionalizing individuals, and definitely in regards to putting individuals in one camp within the downtown core or any type of campsite situation. I know we definitely need to have a stronger policy in regards to our winter response. And that's definitely something that should have been addressed with our past council. And if elected, I will not be putting onus on the next council that's riding. I'll be putting plans in place within 1 to 2 years so they can be achieved with the riding council sitting. And looking at other pilot programs that are successful within other provinces and city is something I'm very passionate about, and advocating for those in regards to homelessness. There's very successful programs in Calgary that the city actually pays for the rent of individuals who are not in a mental health crisis or addiction situation, and they're able to allow those individuals to have rent, and they're paid and not having to worry about them until they are able to find employment and move on to their individualism. And other individuals are able to use the services that are currently available so that we can free up a little bit more beds while giving individuals the freedom to have their own property and move and become contributing members of society. And I'm definitely against a police city as well. I don't want to hire in excess of force. I'm definitely interested in another pilot program similar to Hamilton, which is the mental health officers. These are trained psychologists, DSWs. These are individuals who will be first on scene. As a DSW who worked with extremely aggressive individuals with self-injurious behaviors, working with the police, they weren't the right step, but they were the only individuals who could reprehend situations of extreme aggression. So definitely advocating for the right individuals to be first on response. And just overall, thank you so much, Jeff, for hosting us. Thank you so much for everyone for sharing. It's been very much a pleasure, and I'm definitely interested in listening to everyone's concerns first. Thank you.
Haynes, I'm gonna look at. Jeff, I wanted to point out that there's a few other candidates present. Matt Nicolaitis, Hadley McAllister, Sarah Lehman. Did any of them want to address the meeting? You're muted, Jeff.
Thanks for doing that, David.
And for the last 45 minutes, the agenda was to talk about healthcare and wrap up, maybe move towards some consensus items. I heard something about a consensus about declaring an emergency, for example.
So David's from the Council of Canadians, and we had the moderator just bow out. So David, in the last hour, graciously agreed to at the last minute to help with the moderating, and he's let me run with it. But he's been very supportive in keeping me on track. So thanks so much, David, and the Council of Canadians.
Dirka just got here, so she's welcome to step up as well. But I'd love to hear from some of the other candidates, Sarah or Matt or Hadley, if you want to say anything. Or anybody else we're missing.
Anybody have any thoughts or comments before we move on to healthcare? I just wanted to say that I think we need a citizens task force to keep meeting and keep talking to City Hall and pressing them forward on first declaring a state of emergency like 5 other cities in Ontario, and then adopting the rent geared to income, 30% of income. 1/3, 1/3, 1/3 that Lifespin director Jacqueline talked about. So these are things that we need to work on together, and maybe keeping this group together and pressing City Hall on this issue like a petition for emergency. Go ahead, Matt. Go ahead. You have the floor, Matt.
Yeah, so sorry, I apologize. I've actually been double booked for meetings, so I've been sort of tuning in and out to this event here. Um, so uh, what are the, so I apologize. What is it that you would like me to speak in regards to?
Well, just we're talking about housing and homelessness and harm reduction. Jenna Rose said there's only like 5 beds for detox in the whole city. 5 cities in Ontario have declared a state of emergency for their home housing and homelessness. Jenna Rose said that people are going to die if we don't act quickly on the streets. They're going to lose hands and fingers, and that's kind of where we're at. So hoping that a few people will take the lead and help us declare a state of emergency help. But anything you want to talk about that you think is pertinent, or about your what you would like to do at City Hall.
Sure. I mean, obviously our housing is in a state of emergency right now. It's folks who are unhoused. It's folks who work full time. It's folks who have families. It's folks who are living as singles. It's folks who are, retired. It doesn't matter. I mean, everyone's kind of getting screwed with the housing crisis we have right now. We have a city hall that has decided that it wants to work exclusively for developers. We have developers funding a number of campaigns in this election, which is incredibly disappointing to see. But we absolutely have to put the priority for working class people and for those who are unable to work, and that's what my whole campaign's been based around. I mean, we're in a state where housing, where basic shelter is somehow considered a luxury to a lot of the people that are presently in power, and that's something deeply offensive that we should be challenging every step of the way. I mean, everyone deserves a roof over their head, but we have a city council right now that's decided that they're going to let developers have laissez-faire whatever they want to do. So we have these $2 million houses on the outskirts of town. We have nothing going up that anybody who actually lives in the city of London can actually afford. And it's an absolute travesty. We need to do far more to build up and not out. We need to end the province's policies of exclusionary zoning, and we can do that by applying pressure as a municipality. There's a lot of steps that we can do, and I'm really tired of a lot of the current council saying, "Oh, we can't do anything. Oh, it's the province's fault." Meanwhile, they don't do anything to actually advocate for working people in the city of London, and we need to be cognizant of that. Right? We have a city council right now that's decided that laziness is the course that they're going to take. They have an elitist attitude. They have their houses. They already got theirs, and they're saying, "Screw you" to the rest of us. And that's a large part of why I'm running. I'm the only renter that's running in Ward 4, and I'm looking to be an advocate for tenants. I'm looking to be an advocate for folks that are unhoused. I'm looking to be an advocate for people that are not wealthy homeowners. And it's time that we have folks here that are representing people who are not the rich at City Hall, which has not happened for a very long time.
Jeff, you're muted.
Thanks, Matt. Just wondered if one of the other people with you wanted to speak, or there's other people that just arrived that are candidates and want to just speak. Okay, Ashton, go ahead. I'm just unmuting you.
Oh, great. Yeah, I just had a quick question. If anything's going to be done to increase the number of family doctors in London, I find that it's hard to find a physician, and for me, specifically a female physician, as I have dealt with gender-based violence throughout my life, and I'm not comfortable with having a male family doctor. So right now, I've been working with I forgot there's a bunch of services. I have my current doctors at Student Health that are trying to help find me doctors out in the community. I have former doctors trying to find me doctors in the community, specialists that know people that are doctors, but there's such a long waiting list. And there's also a bit of discrimination when it comes to people with more complex health conditions, as family doctors are less likely to take them on. I'm not too sure what London is doing to ensure that A, it's an environment that medical practitioners want to come here and work and set up homes and raise their families, and B, how are we going to get away from these just walk-in clinics when people need proper doctors to consistently follow them to recognize changes in their health instead of bouncing around to different people who don't know your health history very well.
Good question. I know there's a doctor shortage. Everybody's really struggling to find a doctor. I think there's a registry of doctors that are taking new patients, and we could certainly try and help you find somebody. Like as a nurse, I can call a few doctors and see if they have any suggestions, or message some people. So
Jeff, can I talk?
Yeah,
Jeff?
go ahead. Go ahead.
Okay, so Ashton, if you need a doctor, just give me a call. I'm Khalil Amal. I send you my phone number. So we have a couple of clinics here in London. We can help you out. And but as a matter of fact, as you said, Jeff, we have a 118,000 patients, orphans in the city of London. They don't have a family doctor to go to. So I think what we need, of course, if I get elected as a mayor, I would create a task force to recruit doctors from across the province to come to London. As many people know, London not as attractive as it used to be. So that's why doctors, they don't have anything, to do in London. That's why they're leaving to Toronto, to Oakville, and many different locations. So, yes, I'm more than happy to help. Give me a call, Ashton. I'll try to find you a doctor. Okay.
For myself, Ashton, I too am on a waiting list. Moved here to London around 15 years ago, and it is hard. I do too want to find a female doctor. I have a granddaughter that is nonverbal, autistic, and epileptic, and it has been a struggle. There's no quick fix solution because there's so many different variables, from what I'm understanding, for not having doctors stay within the City of London. But what we're going to have to do is try to find some solutions to the problem. How that will look, I'm not too sure, but doing some research into it and getting back to the group. And if anyone else has any information, then we can work collectively together to see what we can do as a community to see how we can solve these problems, to see how we can get some more doctors in that will be, women, gender, and of different colors and ethnicity. So we have that inclusivity as well. So there's no quick answer, but together, I think if we can research it, and I will start doing that as well, we can do that.
Thanks so much, Sandy. So we hear from Colleen, Prab, and Penny, and then I'd like to briefly outline what's happening on the front lines of healthcare in London and across the province. Go ahead, Colleen.
Again, thank you everyone for inviting me here tonight. The one thing I'd say, I actually came to just listen and hear what some of the issues were and see if anybody was coming up with some solutions. From my perspective, I've been a renter since I was a child, and I've been in London for 15 years, and I've been through several of the systems because I've struggled with unemployment. I've had to be on welfare at times, and I also have disabilities. So I come from a perspective of understanding some of the things that people have to overcome. My circumstance, I am definitely not like a lot of people because I have actually risen above a lot of things. I know barriers are very difficult, so I do not take that lightly. So I really just wanted to say I appreciate hearing all the stories that everybody's providing, and also some of the solutions that are coming up tonight. So thank you again for letting me be here.
Thanks for that, Colleen. Go ahead, Prab.
Jeff, correct me if I'm wrong. So the provincial government is the main source of housing and homelessness services funding in Ontario, right?
To be honest, I don't know the answer to that question.
No, not necessarily, not necessarily. So the city play a pivotal role in this matter, and the city should take the initiative. And concerning the healthcare, yes, belongs to the province of Ontario, and also the feds will participate too on funding those initiatives, especially affordable homes. It's a combination between three governments.
Yeah, thank you. So the reason I brought this up, when we talk about homelessness, we're told that it's been downloaded from the province to the municipality. That's the response we hear.
Well,
right?
combination between the three levels of government.
Right.
So we don't want to keep it thrown the blame on others. I think we should take the leadership and solve it once for all, because it's important for us in the City of London. We have to deal with it locally. And as I said, we've given millions of dollars incentives to landlords to keep their building closed downtown. And we could invest it in solving the homelessness issue. Will benefit us more, and it will give us more productivity. So at the end of the day, we'll make money, we don't lose money. It also will attract more people to come open in the core and also invest in the City of London. As we speak right now, people not coming to London because we're not attracted. We don't send a good image in terms of social support or security and safety.
Well, my question is just hijacked. So I apologize, Khalil.
Right.
So no, that's fine. That was not my question. I understand the perspective. I know the governance of three level of government. My response is to you this. Well, isn't the homeless a problem London as a whole, or is it just the problem in certain pockets? That's my question. It's a problem in London as a whole, right? Okay, here's the thing. So we want to work as a collaborative with all council members. There are 14 councillors. But if we want to tackle the homelessness and put this to end, why can't all parties work together? If we live in London, we live local. That's my point. That's what I was getting at.
That's what we need to do. Absolutely.
We need to work together.
I agree.
As a Londoner.
Yep.
Not just rather working as a party. And you know what I'm, so if councillors should work together, why not MPs work together with each other? Doesn't matter whether you're conservative, NDP, liberal, green, or bloc. It don't matter to me.
I'm just going to interject there at Sandy here. And so that's exactly what we have to do. We have to take those barriers down. We have to start to work cohesively together. I always talk about silos. We can't be in silos anymore. We've got to start to work together and hear each other's voices. It doesn't matter what situation is in the city, that all voices should be heard and brought to the platform. Because sometimes the city will have one eye, but you know what? That coalition group or that single mother or that senior that you bring on, they can see something differently than what we're seeing. And so we are a city. We have to start to bring those voices together. And that's what is true inclusivity. We can't be, you know, it's breaking my heart when I hear all of this. Like, are we gone insane? Like this is totally unacceptable, right? There is so many, I'm sitting in so many working groups, CDIS, I'm on all these different kind of working groups. And I say to them, why do we have 6 different working groups in the city to do all the same thing? And it's the same thing. You're just talking. We got to put things into action now and drive the deliverables. We can't keep doing this anymore. People are dying. I don't know if people don't understand the seriousness of this in the city anymore. People are dying. I have been in a place with my children where I was on EI. I know how it is to be a renter because that's what I do. I have owned and I'm renting. So I have these lived experiences. I know what it is to live on EI and have to pay your rent and have to try to put food on the table and do all of that. I had to, before years ago, access the food bank. I know those struggles. I have lived it. And this is not acceptable. But can we solve it? It's going to take time. But if we can have that platform that we hear each other and come together on that table, there's so many good ideas. I don't know why we're not listening until it got to this point. I'm going to be researching into this emergency plan here to see what it is and reach out to some of those that I know in Hamilton and in Parliament and see what we can do, because I'm going to research that. Because if Hamilton, other places have done that, I was saying to myself weeks ago, are we not in that stage where we should be saying we're in a state of emergency? But I'm going to look into it and then reach out to others, other MPs and stuff like that within the city, and get their input as well on that. And I think it's very important.
I just want to
go ahead, Rob. Sorry,
I was just going to conclude it. Number 2, Jeff, we're not here to promote our platforms as candidates. I cannot stress enough on that. We're here to solve this problem as Londoners, as humans. We need to understand this. I understand that, we want to put their name out there. My question is to everybody, what have been done prior to the nominations? Have been on the field, have you felt the pain before this? Or it just is like, this is just a candidate thing or drill? So some sort of, the way to get our name out there and use this meeting as a platform to polish our campaign. It shouldn't be happening like this. We should work as a team. And when I said, let's work together, I mean, let's work together, keep the party politics apart, come out as a Londoner, as one team. Let's push the car forward instead of pushing from all the directions. That's what I mean. And I guarantee you that, Jeff, this way, we'll definitely find solution, and we could definitely, put homelessness to end. Thank you.
Sounds like a plan, Rob. So I'll let Penny speak, and then I just want to speak briefly about what's going on in healthcare. And then we'll hear from healthcare after I just share a few brief things. Go ahead, Penny.
Okay, a couple things. Yes, we need more doctors, but with doctors, you need transportation. With paratransit, I had to cancel 2 weeks in a row for my treatments. Second, if you go on YouTube and you search Marketplace March 18, 2022, home care and crisis, look at the model that Denmark has. They do not segregate the disabled from the poor. They do not desegregate the homeless from the poor. They don't desegregate the seniors from the poor. It's all in one society. They have one community. They have a daycare, the seniors, the disabled, and they have less homelessness in Denmark than Canada does because they put the supports there. They don't segregate it. They have where all groups work together. All government works together, not provincial, except from federal, not federal from provincial, not municipal. They all work together, but they have the seniors together with the children. They have the seniors with the disabled, the homeless, and they have less people that are homeless. Like I said, look at the taping from March the 18th, 2022 for Marketplace, because I did part of that for the home care crisis.
Thanks, Penny. I appreciate you sharing your experience with healthcare. Chesney, do you want to speak? And maybe Durka, and then I'll just talk about privatization of healthcare and a few other things.
Yeah, that's great. Thank you so much, Jeff, for allowing me the opportunity to speak here. And thank you for everyone who's spoken before me. I was just curious about the school board trustees. So I, as everybody knows, I love to information seek. And I was just curious online. I haven't seen anything in regards to the school board trustee. Oh, no, that's okay, Jeff. The school board trustee links, like they're not as accessible as the counselor how do you say it, like the counselor information, and I thought that was like kind of interesting thing. So like you go online and you see information about the counselor, ward counselor, because you see news about the ward counselors and you see news about the mayoral candidates, but you don't see much about the school board trustees. So I started to think like, what do the school board trustees do, and how do people obtain information? Because I started to have these conversations with my neighbors, and I thought, you know what, how can I start to share share this information? And I thought, this is interesting. And I'm not sure, like in my ward, we have a Facebook page, and I know Old East Village has a Facebook page because my cousin lives there as well. And I thought, you know what, like I don't see anything being shared in the Facebook pages about that. And I thought that's kind of important, isn't it? So is there okay, so to my question, where can I find the information to the school board trustees on this call about the school board trustees who are running? Is there one page where all of the information is, or is there some collective? Like, I'm just curious. Is there anything to that, or like what is? I haven't had anybody at my door come and campaign, so I'm just throwing it out there.
Destiny, can I interject and answer your question maybe? I just posted a quick link. So all of the trustees are actually also listed on the city's website, the list of candidates. If you just scroll down to school board trustees, it will break it down by school board and ward. And you're not alone. A lot of people really don't know what school board trustees do. It's kind of a failure of the system, I think. But at the end of the day, if you go to that list, you'll see who has websites up. Sherry, who's also running in Ward 7, 8, 9, 10, 13, just posted also a link to another list of candidates. So if you know what ward you're in and you know what board you are listed as a supporter of, you can find your candidates right there. And I would definitely encourage you to reach out. All of us, I know, are definitely willing to answer questions about what trustees do. And we're used to answering those questions because so many people have no idea. And you're not alone if you're wondering what trustees actually are about.
That's great. Thank you so much, Eric. Like, I just try to inform the community members here in my area, just so that they have a better understanding of what they're allowed. Like, I shouldn't even say where I work, but I work. Nope, not gonna go there. Anyway, so I have this lady that I work with, and she goes, like I've been in Canada for, oh my gosh, going on like 17 years, and I didn't even know this much. And like, you've inspired me to get my GED and all these things. And like, thank you so much. Thank you so much. And like, I send her all of this information, and she's just so thankful. So it's like, you know what? I didn't even know, but it's just taking the extra time out to connect with these people and just resource and data mine and just do all these things. But, like, I know you're busy, and I know like Jeff is so busy, and Durka, and like everybody, it's just taking the extra time and effort to care, right? So, but it's a big job. And the one thing that I really wanted to say is, you all have a job, and it's it's upon us as citizens too to come and say, okay, you know what, we have concerns, but coming with maybe some possible solutions. Like, it's really interesting to see where the crack in all of this is. So it's really interesting, you know, like the innovation, right? There's a leader, and then there's the innovative thinkers. There's all types of people out there. So it's just really quite an interesting thing when you come down to it. So anyhow, I really appreciate everyone on the call tonight, and I really hope the best for everyone. So that's all I have to say. I just wanted to that's great. Yep, thanks.
Thanks so much, Chesney. It's a really important question you had. Sherry, did you want to make a comment?
If I can figure out how to unmute myself. Oh, can you shut your thing off? So sorry. There's two of us in the room here. So, okay. Yeah. So I knew that was going to happen. Yeah, I just want to quickly thank you so much for bringing up about the school board trustees. It is a problem we have every election, that the coverage just isn't there. The interest isn't there. We do attend all those mayoral debates that you can watch on video, but we're just physically there talking to people before and after and sharing our materials. But yes, to everybody who is here on the call, I would just take a 10-second plug here to encourage you to check out who is running in your area. Please don't leave this vote to chance. Yeah, I would just look into who's running, reach out to Eric, reach out to me. We can answer questions, and we're happy to share more general information as well, regardless of who or where you're voting.
Thanks so much, Sherry. And speaking of plugs, the Council of Canadians has a annual general meeting coming up, I think November 23rd, and they have a fabulous speaker, Natalie Mara from the Ontario Health Coalition, and she's going to talk about the horrible state of healthcare right now, how the government's privatizing our healthcare, and we need to stop the provincial government from doing that. So, I just want to know if Durka wants to say a few words, or whether I should go on and talk about healthcare. Healthcare is voting has spoken a few times, so I just want to make sure I talk about the current healthcare stuff, and Durka gets a chance to talk before we go to healthcare as well.
I'll be very. Thank you very much. I'll be very brief. First of all, I want to thank all the candidates for both for school trustee and mayor and councillors for attending tonight. We're very proud of this community that we've built here with the London Regional Social Forum. As a member of the community, I want to thank you for taking the time to listen to us and also share your ideas. I'm going to switch hats to me being the chair of Unity Project Board of Directors. It's been a very tough 2 years for not just our staff at Unity Project, but I think I can say this for across the board for anyone working with addictions and homelessness in London. It's taking a toll, the amount of deaths, and the fact that they're increasing is also worrying us. It's worrying us too that we're seeing pregnant women on the streets, worrying us that there are many families that are on the brink of homelessness. This affects not only people living on the margin, but it has repercussions throughout our city. So this is not a downtown problem. This is not a Ward 13, because Ward 13 is downtown problem. This is a all of London problem. And I'm very heartened to hear that people are recognizing this, and I hope that this goes into your future thoughts, because housing is a very important social determinant of health, and that's where this conversation is going to go. Okay, thank you so much for your time.
So we've only got 5 minutes left to talk about healthcare. So I just want people to know that our hospitals are in crisis. There's like our pediatric ICU units are full across the province. So we actually have to ship kids out to Buffalo right now. There's 18-hour wait times. There's 25 to 30,000 shortage of nurses in Ontario. And there's, nurses are just burnt out. And instead of funding new beds and hiring nurses in hospitals, Ford is giving money to private clinics. He devoted 24 million to them and said he's going to expand them and expand private hospitals to deal with the surgical backlog. But I'm here to tell you it's a big mistake. We can't afford to privatize our healthcare because it costs more. The outcomes are worse. There's more death and worse patient satisfaction. There's a number of things why it's so bad. The surgeries that they're going to take actually help pay for the public system, and so we're left with sicker, more complicated, costlier patients in the public system with no way to offset the costs. And nurses were already 25,000 short. They're going to go and work in the private sector, and it's going to be worse. The wait times will actually be longer. So there's a crisis coming that's already here, but we need to figure out a way to stop Ford from privatizing our healthcare. And it's not just the hospital services. It's he's privatizing the last parts of home care. 30,000 long-term care beds are going to go to for-profit companies. Some of the worst offenders during the pandemic are getting 30-year licenses with no strings attached, even though, a lot of people died in the for-profit nursing homes. Let's see what else. So I'm a nurse and I've worked in long-term care and acute care, and it was like this long before the pandemic came. Ford made tons of cuts. He wanted to go from 22 ambulance dispatches down to 10, 50 public health units down to 10. They're looking at privatizing the ambulance services, private virtual medicine, private delivery of COVID testing. You name it, it's all becoming private. And it really undermines our democracy because all these companies in the States would love to be part of our public health care. Like the Ontario Chamber of Commerce presented Ford with a report trying to make our $52 billion healthcare system open for business. So this is a really bad thing, and we need to come together and try and stop it, to be honest, because it's really the soul of our nation that we decided that people should get healthcare based on need and not by ability to pay. It's one of the greatest things about our country. It's a great thing that equalizes us, ensures equality, that people don't lose their homes when they get sick, that people don't get to the front of the line just because they're rich. It's better to have just one public system than allow people with privilege to get to the front of the line. Because if you think we're not funding healthcare now, it's going to be a lot worse. And I'm just going to defer to Peter Bergmanis, and he's the co-chair of London Health Coalition. Go ahead, Peter.
And thank you so much, Jeff, and my apologies for having to arrive so late in the meeting tonight. And many thanks to all those individuals who've come out tonight. Many of us are in different meetings over the course of the week. I even came from a long-term care facility that I had to deal with just prior to this. All I want to say is to the candidates, this is a town hall of the citizens that are going to elect you. I appreciate that you have stepped up and taken on a role to look after your community. I will tell you this, the Health Coalition is looking for some certain strong signs that you are in favor of universal public health care. Jeff just outlined what we're worried about. On the community level, long-term care, municipalities' best record during COVID. We want that to be enforced. We want it to be brought forward in town hall meetings. We want our city to stand up for that and expand it. We have no excuses for letting for-profiteers moving in. That means that we want our candidates to say, yes, we're going to defend public health care, municipal homes, and that will zone out for-profits. That would be an impressive statement if you are willing to do so. On our public health units, we want them to be supported, not downsized, amalgamated. They're a bulwark against what happened in COVID. And if they are to be torn apart, you will not get the vote or the support of the London Health Coalition. You have to be there ready to fight for it in City Hall. And finally, our emergency medical services, look at this. We're in code 0 and code black when ambulance services can no longer function properly to save lives. We have a role as a municipality to save lives, protect the welfare of our citizens, and support our public ambulances. So you better be on board with that if you want the London Health Coalition to support you. So if you can come back and tell us that that's what you're about, we're here for you.
Jeff, I also put the link to Marketplace in the chat if anybody wants to go to it.
Okay, great, Penny. Yeah, Penny was on Marketplace for her experience in the system, and she shared, and that was amazing. There is a healthcare town hall this Thursday in London. The local MPPs are hosting, so if people are interested in that, I encourage you to join in that, because I think all these things, the homelessness, the housing issues, the harm reduction and healthcare, it's all related. Like if we remember, go back to it's a long story, but say in Harper's time, they cut taxes to corporations by 20 billion, and Wynne cut taxes by 15 billion to corporations and some of the richest people. So that's 35 billion a year. Mark Carney, the governor, the Bank of Canada governor, said at the time, you know, they're sitting on 600 billion, and a lot of that money could have gone towards healthcare and education and housing. So the neoliberal, the neoconservative kind of main thrust for 50 years has been decrease social spending, decrease taxes, privatize and deregulate. The Nordic countries have a better model. They kind of resist this and have a progressive tax system. But the one, the neoliberal one, the neoconservative one, tends to make the rich richer and the poor poorer. And they tend to privatize and sell off our social programs and decrease our capacity to provide social programs. So, you know, look for candidates that would like a progressive tax system that we can actually afford to spend a little more on hospital beds, on nurses. Like Bill 7, we didn't mention that. Seniors are being forced out of hospitals because they haven't, the government hasn't increased the number of beds in years and years. So they're out of bed, so they're forcing seniors to go to homes they don't want to. And with Bill 124, Ford gave nurses only a 1% raise, and they were already just, you know, just at the point of breaking. And for the government to turn around and do that, they've just left the profession in droves. So those are some of the issues in nursing and healthcare. But that's about all we want to say. We'll be planning Natalie Mayer is coming to town November 23rd to speak at the Council of Canadians AGM, and where the London Health Coalition fights against privatization and cuts to healthcare. It's never been that emergencies were closing all over the province, and we have to fight this tooth and nail. So we'll let you know about meetings to try and protect public health care, stop privatization. We'll have meetings on housing where we demand that the city do a declaration of a state of emergency. We'll also try to put together a citizens task force and try and deal with some of the issues we've talked about on this, but we'll probably do it shortly after the election. Anybody? I'll let healthcare speak, and then I'll let anybody ask any questions, and then we'll wrap up. Okay, go ahead, healthcare. Or Peter first, was there anything you wanted to add? And then we'll hear from healthcare.
Thanks, Jeff. Just thank you, everyone. It's been a long night. And again, we're looking for those people who are actually committed to universal public health care and all the things that a municipality has some control over. It's a democratic process. It's accountable. That's what it was meant to be. And I look forward to candidates responding as such and letting me know. I will certainly be at the MPP meeting at Horton Street at the Goodwill Industries on Thursday. So looking forward to seeing what our colleagues at the NDP have to say. Anyways, we know it's a crisis, and I know that Londoners will step up and do the right thing to help out.
Thanks, Peter. And we'll give the last word to healthcare. And then if anybody else has a question, everybody else can bail and they can just stay on, and I'll be happy to answer questions. Otherwise, just reach out to me anytime and let's stay in touch and let's work on these problems together. Go ahead, healthcare.
Okay, here I am. Okay, so for healthcare, I'm not personally affected by the wait times in the hospitals, but I know that we have a lot of influx of people coming in for tournaments during the weekend, and we have an influx of people living here from Toronto. I think they having access to primary care is part of the backlog. But I'm curious as to the urgent care. I believe the urgent care is only open until 5 o'clock. Come around 5 o'clock, I think they close for over at the St. Joe's, if I'm correct still. And that's nowhere else to go. There's a few walk-in clinics that are open till 8 p.m. But that definitely is a issue with access to doctors when you have sports injuries. You know, you can't just say you have a swollen ankle. It could be a broken bone of some sort. So, you know, you can't just minimize it. And for doctors, new doctors coming into they had a thing for new doctors. I think we need to have a lot more foreign doctors come in and do specialized training, and then have the ability to stay here because they are self-employed, and if they are not hired by the hospitals, which they get different pay rates. But I think the specialization will help with access to primary care because a lot of family physicians have complex patients, and you have to outsource it to a specialist because, you know, there could be something else going on that needs more consultation in that. So that's the provincial issue. I think the city needs to look at how to make it attractive to gain doctors here, just like some of the rural areas have done. They have looked at how to gain doctors up there, and they make incentives for them because it is very costly to open up a practice. So my doctor, he's foreign trained, but Canadian standards. So he took his 4 years for family physician, and his wife's trained too. And they started out in a walk-in clinic, but then they took over another clinic and built he got patients, so he's pretty busy. But I just actually seen him today. So anyway, I could go and I can get him virtually instead of going in and seeing him within a week, just within a 24-hour period. So, I mean, doctors have to be more incentive to how they make themselves accessible to their own patients. So if somebody can wait for 24 hours, you know, I can call him, I can get him by tomorrow. So, and another thing, I think there was an after hours doctors clinic, and they closed down too. So they need to think of more ways to outsource doctors without having to go to the ER for some minor conditions, but you can't minimize what's minor and what's not, right? So apparently telecare, they are pretty busy. It takes hours for them to get back to you. So I mean, there's definitely the flow of access to any medical care is major, and people are like waiting months for to see a specialist unless you get fast tracked through a hospital. So I can remember back in the day that you could see a specialist like within 2 weeks. So that was a long time ago. Things have changed and how the policies have been set aside with different governments of the day. So it definitely, it's not efficient in having all these backlogs, and definitely you get better care when you see specialists in the hospitals and that. And the privatization is, you know, it's questionable as to the quality of care you're going to get. So I'm sure if you got money, you can, the privatization already happens. People get ahead of the line and, you know, pay whatever, and dermatology clinics and that sort. Like there are private clinics that do plastic surgery, right? So, I mean, in dermatology and that sort of thing. So it's already out there. It's just about privilege. And I think we have a universal legislation that is that we get public health care. So, and that's from a federal level. So you definitely have to advocate for your own health care rights and vote. So that's what I want to leave it as, is we have the power to vote and to be involved in understanding what's going to affect us without, you know, with some of these policies that different governments of the day enact. So I hope you can have some food for thought in who you're going to vote for the municipal election, because homelessness affects us all. So it affects our quality of life when we go downtown to a concert, you know. It affects our quality of life when we have to go to the hospital, and it affects our quality of life and just enjoying our community. So thanks.
Absolutely. Thanks, healthcare. You know, the government will put the corporations in charge of public delivery, and they'll look at two treatments and they'll pick the one that makes them more money that may not be the best treatment. So that's a bad thing, and they don't want to be inspected. Like the nursing homes, they you know, they lobbied the government not to be inspected, and we saw what happened during the pandemic. It was a disaster. Go ahead, Rob.
I just wanted to make a last remark there, Jeff. I believe that leadership is a solution to all, municipally, provincially, federally. So this term, let's elect a leader, not a politician. We're done with politicians making promises at your doorsteps, you know. And I literally told everyone, interview your candidate, literally, make them think on cold feet, see what kind of leadership they possess, right? And that's the kind of leader we want. Listen, I'm not in it for you. You know, it's not a piece of paper I have from the university, or I'm a PhD or doctor, a lawyer, or whoever it is. What can I do with that piece of paper? How can I turn that information to education? That's the question we're asking here. This is not just about this election. We're talking about future. 4 years, my friend, that's a long term. We need to make sure that, you know, and then as a humanitarian, because I don't want to, you know, put myself as, you know, I practice law, this and that. I tell everybody I'm a humanitarian. Let's work together as a community. That's all it is. This is the only way we can help each other out. Pretty much it, right? And I'd like to thank everyone out here, the trustees, the candidates, and thank you, Peter. I echo you when you mentioned, you know, how are we going to improve healthcare? You know, that's how we improve. We will listen. We work together as a team, right? So thank you for this opportunity, and let's work together, Jeff. Thank you.
I just want to thank David Heap from the Council of Canadians, because I just asked him at the last minute to help moderate, and he really, you know, stepped up and made sure we were staying on track. So thanks so much, David Heap from the Council of Canadians, and please try and attend their general meeting when the expert on public health care will be speaking from the Ontario Health Coalition, Natalie Mara. She's been fighting to stop cuts and privatization for years, and she's done such amazing work. So I hope everybody gets a chance to hear her. So we'll conclude now, and we'll try and meet early after the election. So just I just want to thank everybody for taking part. all the people from the London Regional Social Forum that have been so supportive and keep us going. Thanks for Shiam and Patty Miller for monitoring the chat. And thanks for Peter for coming on. Thanks for Durka for always being so supportive and helping quarterback. And thanks for everybody. If anybody has any questions, you're welcome to stay on, but otherwise I'll try and post a recording of the meeting as soon as possible, hopefully tomorrow. Okay. Thanks for everyone's time, and feel free to contact any of us. If you go to the 3 dots at the bottom of the chat, if you can click on that and save the chat if you like, if you want to have a copy. So good night, everybody, and just keep in touch, and let's try and work on this together. And I'm sure we're gonna hopefully find some solutions. But first, I think we need to declare this as a state of emergency.
Yeah. Thank you, everyone.
Okay. Good night,
Good night,
everybody.
Jeff. Yep.
Take care.
Good night, thanks.
Thanks, Shiam. Thanks for joining, Katie.
Good night, Jeff. Thanks for everything.
Yeah, thanks,
You've done a
Chesney.
great job.
Oh,
Thanks, everybody. Thanks.
You're
It was
too
great
kind,
hearing your
Chesney.
ideas.
Amazing.
Have a
Thanks,
good
you
night.
guys. Have a great night.
Thanks
Bye.
for your patience, everyone.
Well, thank you.
How are you, Katie?
See, oh, hey. Yeah.
Hi, Katie.
Oh, hi. Yeah, just really affected by a few different people passing away this week and in different situations related to health, and someone without a home and stuff that I knew that was Phil. Anyways, yeah, but and I missed some of the part in the middle with when Jenna was talking. So I don't know if you have a recording of it. I could check later, or how
I'm
that
gonna
works, but-
stop the recording right now. Sorry.